Okay, we're just going to give it a minute while everybody's audio is connecting. Still have people connecting. Those of you that are here, we'll just jump ahead and go ahead and drop your name in the chat, where you're located, what your role is today, and what is your your to-go hot beverage for a cold day.
Jessica, just as a note, we're getting a ding every time somebody comes in.
That's because she made you a co-host, I assume.
Oh, am I the only one hearing that?
I'm hearing it.
Okay.
Oh.
I usually disable it after a while, but it's a nice reminder for everyone to join an interpretation channel.
No, thank you.
Okay. Well, good morning and welcome to our joint meeting today. This is joint with the Early Learning Advisory Council and Provider Supports Subcommittee meeting. As you can see on the screen, we've got some interpretation instructions, and it's important for everyone, including English speakers, to follow the instructions so that everyone can hear the real-time interpretation. We also have virtual meeting protocols that everyone can take a look at. If you have a question, please drop it in the chat. We have a tight meeting schedule today. All of the materials can be found on the DCYF website. Again, for those that arrived a couple minutes after I started, go ahead and put your name in the chat, where you're located, what your role is here today on this meeting, and what is your to-go hot beverage for a cold day. We are co-facilitating the Provider Supports Executive Committee, which myself, I'm Julie. I'm located over in Kitsap County, Iona Center. And then Dave, who is also one of my co-chairs for Provider Supports, along with Katie, who is not co-presenting today for her own personal reasons. Also, of course, we have the co-chairs for ELAC, which Lois and Enrica, who stepped down as of the end of October, but they are here today to assist with the transition. Everyone, if you have not already, please change your screen name to reflect whether you're an ELAC member or a provider supports member or joining as a member of the public. I'll do the same because I haven't done that yet. And make sure you share in the chat. We have a leadership panel today, starting right after the introductions, and the panel has been provided with 16 questions submitted by all of you, all of the ELAC and provider supports members. It will allow for about 3 minutes per question for the leadership panel to answer. To ensure that we're able to get through all of these questions, we will not be stopping for any follow-up questions or comments during the initial discussion. You can share your questions and comments in the reflection survey. You can put them in the chat, and the community engagement team will include them in the feedback loop to follow up. Now, we have several, or at least 2, I'm not sure how many. We have a few interpreters today. So I ask that all presenters remember to keep your pace a little bit slower so that the interpreters can keep up. And our co-chairs may interrupt to remind you to slow down so that the interpretation can keep up. Again, if you joined after the very first couple minutes, We may want to go back a slide, Jessica, just to put up the interpretation instructions. Thank you. If you are an English speaker, make sure that you're following the instructions as well so that you can follow along and know what's being said. So, I think that's everything. Let's see. I'm going to go ahead and follow the instructions, change my name to reflect that I am a provider supports co-chair. And if all of you would change your names to reflect why you're here today, in what role, that would be terrific. Yeah, really, we've done it all. So yeah, share your name in the chat, where you're located, your role today. You might be a member of the public attending as a child care provider. You might be a committee member for ELAC. And then what is your to-go beverage on a cold day, a hot beverage? Filling in for Claudette, okay. All right, well, if we're a little ahead, that gives us a few more minutes because I did see that our leadership panel is here. At least most of them are here. I didn't check for Ruben, but I saw Nicole's name and I saw Allison's name at some point. So I'm going to go ahead and pass it over to Lois.
All right, good morning all. Since we are a few minutes ahead, I just want to, I'll be on camera shortly. I actually needed those additional 8 minutes to put out some fires. As you know, for some of you know, I'm an early learning director. So just sometimes 5 minutes can make a big difference in our day. So I
Oh, sorry.
will wait for give people a few more minutes to sign on. And then we'll get started right at or a little bit before 9. So as soon as, I think we're still waiting for Ruben.
Sounds good. I can relate to those fires. Sorry about that.
No worries.
Hey, Ruben is actually with us. We are all here. We're just working on some technology, but we are all here around my laptop.
Good morning.
I'm ready to go whenever you
Wonderful.
are. Happy to take the few extra minutes, Lois, if folks need them and start at 9, but whenever you're ready.
All right, sounds good. Thank you all. I will get us started shortly.
Awesome.
Okay.
Julie, in the meantime, I know we still have some people coming on, so it may not hurt to go over the translation again, as well
Right.
as question of the morning.
Right, thank you. And I've noticed there's a couple of participants still that have not changed their name in the meeting to reflect who they are, their role in the meeting today. Please take a moment to do that so that we know whether you're an ELAC committee member, a provider supports committee member, a parent rep, I saw a parent rep in there, or if you're a member of the public attending. Community engagement likes to keep track of that data, so that's helpful. And even those of you that are DCYF, just put DCYF behind your name, except in the panel, because you guys have a very long name at the moment. So yeah, even if you're an English speaker, please follow the instructions on the screen because you want to be able to follow along and understand what's happening. And again, we want to remind panelists and everyone that speaks up today to speak a little slower than they might normally because we have a few interpreters today and it can be a struggle when we have someone speaking fast. We've been reminded of that by the interpreters, so that's important. go ahead and put your, if you haven't already, put your name in the chat with where you're located, your role today in the meeting, and just your top beverage for a cold day, hot to go beverage.
All right, thank you very much, Julie. I know that all of our panelists are here. So panelists, before I introduce you, just want to remind you that we have 16 questions in total. We're starting a little bit early, but just want to let those who are just joining, what we're planning to do is that we have 16 questions, as Julie shared, submitted by ELAC and provider supports members. We're going to direct the questions to specific DCYF staff, and they'll have 3 minutes to answer each question. If you have any follow-up questions, please place them in the chat. We are going to keep those questions and put them in the feedback loop. We want to make sure that we have time for the ones that were submitted by members. So at this point, I want to introduce our DCYF leadership panel. We have Allison Krutzinger, excuse me, Allison, for if I was a little tongue-tied there, Ruben Reeves and Nicole Rose. And Allison is the Director of Public Affairs. Nicole is the Assistant Secretary of Early Learning, and Ruben is the Assistant Secretary of Licensing. So we're going to start, and then I'm going to ask CE to be our timekeeper for 3 minutes per question. So the first question goes to Nicole. Nicole, what are the department's plans to support providers as the field continues to rebuild from the pandemic?
Good morning, everyone, and thanks, Lois. And I just also want to take a moment to thank you, Lois and Enrica, for all of your work and service on our advisory councils. And so nice to have you facilitating this today. So as we think about our plans to support providers in the field, I would go back to and say that our decision packages really are the foundation of doing that. So we think about how do we continue to increase subsidy rates? How do we really think about how we can implement and move more towards a private pay market for our providers accepting subsidy? So that is enrollment-based pay, prospective payment. And those two things really are foundational, I think, to a larger piece of work that you don't see a decision package about this year, but you'll see a report from us coming in June to the access and living wage. And that is where we need to continue to increase the amount of families that are accessing subsidy. We do have a decision package that goes up to 75% of the state median income, but we know in order to support all providers that we need to continue to increase that the number of families that are eligible for subsidy so that all families are paying a sustainable monthly rate. So we see those three things as really foundational. I would also just say, given our current budget reality, hanging on to as many of the items that have been put in place with the Fair Start for Kids Act are really important to continuing to support providers. And then finally, I would say, as Ruben and I and our teams are going out and having community conversations with providers, you know, we are hearing things through that related to how can we think a little bit differently about staff qualifications? How do we make sure providers know what they can and can't bill for? I know Ruben is hearing things around licensing as well. We think all of those things are and doing something with that is a way that we can continue to support providers in the field.
All right, thank you very much, Nicole. All right, this next question is for Allison. It was a bipartisan effort to form the Department of Children, Youth, and Families. There has been quite a bit of negative press in the last 3 to 4 years. Do you feel the department has met the initial directives? Why or why not? And if not, what is the plan to course correct?
Well, this is a loaded question and certainly is bigger than just my editorial commentary here. I think a lot of
Allison, excuse me 1 second. I'm just going to ask you to slow down just a little bit for our interpreters.
Oh, thank you for the reminder. You probably will have to do that a few more times. So I apologize in advance, but you have liberty to do so, Lois. I think depending on who you speak with at DCYF and ask the question to, we all may have a slightly different take or opinion when you think about, you know, some of the broad scope of our agency and a variety of leaders, assistant secretaries, managers, staff doing the work. I think by and large, this agency was created to really think about a continuum for children and families that really meets their needs. And I think DCYF, despite some blips of negative press, has had tremendous success in some of our charges around prevention, safely reducing the number of children in out-of-home placements. We are seeing less children entering the foster care system now than we have seen in decades. And I think that's a tremendous success. We are seeing more support for families on the front end, building out prevention networks of increased combined in-home services, home visiting expansion, more access to childcare and preschool early learning opportunities across the state than we've seen in years, both in licensed capacity, but also preschool opportunities, as well as more families engaging in the subsidy system. I think those are tremendous successes and part of what this agency was charged to do when we think about a continuum for providers. I think the connection between early learning and our child welfare folks through our child welfare early learning navigators that support families who are on the front porch, I often describe, of potential involvement in a deeper system that we know is not good and has adverse outcomes. Being able to connect with high quality early learning programs in their community is a tremendous success of this agency. Is there more work to do? Absolutely. There will always be more work to do. Our work largely will not be done. We always can get better and do more for families and children and youth across the state. I think there's some areas that we'll talk more about this next year and cycle that we'll lean into around the youth and adolescent space, prevention of sort of young people, unaccompanied young people, or young people on the fringes, homeless, at risk, who aren't necessarily victims of abuse and neglect, but whose relationship with their family is such that they can't go back there, or that's not a safe space. How do we as a state create a continuum of space for those young people? I think there's always going to be more work to do in expanding drug treatment programs. That's not DCYF's mission. That's those of the healthcare authority. But as we battle the fentanyl, that was fentanyl and opioid mixed together, the fentanyl crisis in our nation and our state, we're going to have a lot of work to do as a state to respond to that, to ensure that young children have the care they need safely and families have the resources and support they need to mitigate and navigate obstacles or challenges, barriers that exist for them, drug treatment, parenting, etc. So I will name that I think we have had tremendous success, and I think we will continue to have work to do. I don't think it's binary. I don't think it's a black or white answer.
All right, thank you, Allison. You actually have the next question. How will you ensure that early learning is on the new governor's radar? What are the important issues you will share with he and his team when you meet with him after he's sworn into office?
Well, I love your optimism that I will have a personal meeting with the governor, Lois, whoever formatted the question.
So then to make it clear, then the DCYF leadership team, because or whoever the interim is.
I appreciate your optimism that we will get a one-on-one with the governor-elect. Those aren't guaranteed things, so I just want to name that. I hope that many of us do, both with the governor-elect himself, as well as his policy staff, parts of the transition team, etc. To date, those conversations have not yet begun. That's not uncommon. The transition is an interesting and odd season in that we have an authorizing environment under the current governor that will be transitioning on January 15th. And so I do know that the governor has assembled a transition team, and actually Representative Sen is leading on childcare for the governor-elect. That is her work group that she has been tapped with leading for the governor, and many of us, the agency, and many of you on this call work closely and engage closely with Representative Sen. I know it is a key priority for hers. I know there are others on the outside world who engaged in this conversation with the now governor-elect and others around the importance of early learning. For the agency, our approach will continue to be in the bounds of our decision packages and our asks that we put forward that really live into the reality. And as we, have opportunity to have conversation with the transition team, the new OFM director, policy advisors, our message has been to maintain the existing commitments set out by the legislature. The legislature has been very clear the last couple of years with the passage of the Fair Start for Kids Act around the importance and the value of early care and education, where we need to take the state and goal for families and providers. And our message will be to maintain those commitments, both with the governor, but with the legislature, who ultimately will consider and pass a budget this coming legislative session and into the future. So that will continue to be our ask, and how we continue to promote elements on his the agenda of the incoming team, but also the legislature.
All right, thank you very much, Allison. We'll go to our next question. And just a reminder for panelists to speak slowly so the interpreters are able to share out with those who need support. So Allison, you have quite a few here in a row.
I do. They're all really.
I think I'm going to pivot a little bit and move over to a little bit different topic, and then come back to you. And this question will be, and there's my 3-minute timer. And this question will be for Ruben. Number 6, Jessica. The topic of insurance has risen at several public meetings, with compliance issues being daisy-chained together. A small infraction looks larger to the outside world. Is DCYF having internal conversations on how the agency can support the field, offset how Child Care Check is being used to deny insurance to providers?
Thanks, Lois, and good morning. And I just want to echo Nicole and thank Lois and Enrique for their work as chairs for just an important group as we continue to partner with this work. So good morning. As you know, this has been a topic for the past year, not only on the child care provider side, but also on the foster care provider side. We've had an internal meeting, a few meetings recently, 2 weeks ago, of how we can advocate for both our child care providers and providers who serve foster children in this topic. As many of you know, we have a new insurance commissioner who will be in office in January, which we are hoping to schedule time with her and talk about this subject as concerns that we will be losing providers because of the continuous heights of insurance. And on the foster care side, they're also concerned about not having insurance liability at all. So we have had conversations with Matt, with CCDF about the external facing child care check, and wondering what we want to consider adding as a disclaimer to show that providers listed as open on child care check are not undergoing any licensing actions, and they are in good standing. So we're trying to think of some creative ways that we can advocate for the child care community around this. We've encouraged child care providers, and which I know many of you have already, to reach out to the Office of the Insurance Commissioner to voice their views. We also know that this is a national concern as well, right? And so we're trying to think of ways of how DCYF can, like I said, advocate for the provider community around this topic. So we do have someone assigned to this with our Administrative Services Division and Legal Office to see what that would look like. We also are waiting for our new secretary for DCYF. And we'll definitely put this in front of him or her as a topic that is definitely impacting our provider community.
Can I add one thing? The other commitment that we've made, as you know, the insurance commissioner will be new on January 15th as well. We have a new insurance commissioner for the first time in the state for a number of years. The other commitment that the agency has made, as soon as that new insurance commissioner and team is settled in, we will request a formal meeting to brief them on the impact of the insurance market reality for our provider groups, childcare, as well as some of the foster care and group care space, and try to engage in a more collaborative, proactive partnership with their office, agency to agency, to understand what potential solutions are out there that we may not be aware of as DCYF. So another just concrete step to add on to the vein of what Ruben named.
All right, thank you, Allison. And I would also like to thank on behalf of Enrica and I for your kind words. Thank you so much. So Allison, we're going to pivot back to you now. Ruben had mentioned about the secretary, and that is what our next question is. With Ross Hunter not seeking reappointment as secretary, when is his last day, and what character and leadership traits would you like for the new DCYF executive to possess? And I just want to say, as we're saying you, we're actually referring to DCYF and the leadership team.
Yeah, thanks. Thanks for that question, Lois. I will say sort of newer late breaking news last week, we did get an email that Ross Hunter's last day will be January 15th. What that means for the future of our agency is unclear. I'm sure you all have seen the media reports as Ferguson announces new appointments. Cheryl Strange has been named the acting secretary of DSHS at some point in the new year, and he's begun to make some of those appointments. I'll just be real honest. It is weird to not know and not have any insight into the process or what's happening around that appointment, but that's just the reality of where we are at. So I just want to name that. When I think about the leader of DCYF, I would argue it is probably one of the hardest jobs in state government, second to those who work on the front lines doing DCYF's work every day. It is a complex secretary role with a variety of work strands, flows, teams, approaches to work, reason for execution of work. It covers a wide variety of professions and sectors, if you will, from social work to direct care and early education to juvenile justice and everything in between, complex legal landscape, etc. So it is a really complex role. Having someone who has led large enterprises and understands the skill sets necessary to manage large enterprises. DCYF is an organization of over 6,000 FTE across 70 plus offices in every corner, cavern, canyon, and mountain peak of this state. And understanding how you are a leader and engage as a leader in multi-layered leadership with varying work is really important. Having proven expertise and being able to manage and lead large enterprises, I think, is something that's really important for the next leader. I think some orientation to the content and the context of our work is also important, but I recognize it's highly unlikely that there is someone out there that has had direct experience or practitioner work across the continuum. There may be, but I recognize that our continuum is big, but having an orientation to understand how children and families grow, how they develop, how they live and exist in community, and how communities exist in an ecosystem of a world, understanding how state systems really can and should impact children, youth, and their families for the better, the role of state government can play in advancing economic prosperity, prevention support, family stability. I think those skills are really important for the next iteration of DCY.
All right, thank you very much, Allison. And then you have the next question as you reset your timer. And thank you for slowing down for our interpreters.
Thanks for the-
How can ELAC and other community groups be part of the process to weigh in on the type of person who should fill that role?
Yeah, great question. I don't unfortunately have a great answer. As I mentioned, it's not, I don't know all the process details of how those decisions are being evaluated and made. I do know there's a 53-person transition team. That list has been published by the incoming governor, the governor-elect's press team. I would encourage you to review that list and see if there's folks you have relationship with and want to engage. I don't know if or how that 53-person transition team is engaging in leadership decisions, but that's one avenue I would suggest that's out there and that's public if folks are interested in engaging. Beyond that, I unfortunately am not, we're not privy yet to sort of how those decisions are being made or what that process looks like right now.
All right, thank you. I am going to move to Nicole. I have a question for you. There is an education cliff on the horizon. What is the department's plan to offset it, and which legislators is DCYF collaborating with to make this occur?
And thank you, Lois and team, for the question. And I'm going to ask Ruben to chime in here as well as we go through this. It's certainly something we've heard a lot about as we've gone out to the community childcare forums and from you all as well. And I think it's good to level set with some overarching goals around, making sure providers in all roles have the knowledge, skills, and abilities to meet the needs of the children and families that they're serving. And that I think we've wanted to consider both education, experience, and training. I think there has been a longstanding history of wanting to think about how we create and sustain pathways that meet the diverse needs of providers. And I think sometimes in doing that, the variety of pathways can sometimes feel like making things a bit more complex than they need to be. And so how do we get back to a place where we have a streamlined process and really understand sort of at the core, what are the basic things that childcare providers need to know and be able to do? We recently received some funds through the preschool development grant as well, which folks will be hearing about later today to help us really think about how we can clarify some of those pathways. One of the things that we have certainly heard about is childcare basics and how might we segment the content of childcare basics in a different way that's a little bit more digestible and accessible. And sort of thinking about how we're getting providers just the right knowledge at the right moment for the role that they are doing. How are we looking at the hiring requirements? One thing certainly that we are looking at is the experience-based pathway. And instead of having folks opt in to that, is there a way that we can just administratively say all of those providers that were in good standing, that meet that experience-based pathway requirement, meet their qualifications? Another thing that we have looked at with that is extending that experience-based pathway to 2028 to capture some of those providers that came in during the height of the pandemic. One of the things you asked about is what legislators has DCYF been in conversation with. We have talked with Representative Sen, Representative Eslick, and have shared some data with them, and have also really talked with them about that it's time probably to bring providers together again and have us look at some of those pathways and equivalents and say, does this still make sense? We thought there was going to be a lot of interest in PACE. There's not as much interest there. And on the other side, we're seeing wait lists in our stackable certificates. So how do we really look at some of that supply and demand? And so that's some of the work that we've been doing. But I will also turn to Ruben, because I know he and his team have been paying attention to this as well, as we've had an internal work group.
Yeah, like Nicole said.
Nicole, Ruben, I'm sorry, we've run out of time.
Oh, Nicole.
That question. But it is really important. And if we have time at the end, we'll come back to it. So Ruben, try to jot your thought down and hold it. I know that can be challenging.
Yeah,
Thank you so much. And then Nicole, this next question is for, let me see, for you as well. How is DCYF collaborating with OSPI, which is the Office of the Superintendent of Public Instruction, on the regulations that early learning must abide by in comparison with the less regulated transitional kindergarten programs, TK, where decisions seem to be based on district versus universality? Blah. For example, this seems to apply to education and health and safety requirements, i.e. ratios, playground safety, and student supervision.
I'm happy to start on this question. I think there's a question here around, just regulation in general. And I was having a conversation with Samantha Bowen, who's the director of early learning yesterday. And I think one of the things that's important for this group to know is that transition to kindergarten must follow all of the K-12 Washington Administrative Code or rules. And so part of what Samantha shared is that as they are working on their transitional kindergarten guide, which they are posting on their website, as they look at some of those other WACs that are relevant to transition to K, that they are posting those. OSPI also recently posted their rules that were based on the 1550 legislation. And so OSPI does put those rules out there. And OSPI is responsible for the regulation of those transitional kindergarten and transition to kindergarten programs. We have seen spaces and places where folks, and I will use Spokane Public Schools as a district that is bringing together their state-funded pre-K and their transition to kindergarten in the same classroom. I will note that transition to kindergarten and state-funded pre-K and early learning are under different agencies and different authorizing environments. And so we are really trying to work together where we can to talk about the intersection of those rules. I will get online or put in the link later, the transition to kindergarten page where folks can see all of the guidance and rules that are out there.
All right, thank you very much, Nicole. And we do have a few seconds left, about a minute. Ruben, do you want to jump back to the education cliff question?
Would love to, Lois. And I just like Nicole said, we recently met with Representative Sen and Eslick and partnering with them. We also, like Nicole said, we need to hear from the child care providers regarding staff quals. So we are committed to that. We will be changing the WAC on this. I don't want to put a time frame on it, but we will be changing the WAC requirement around staff quals, but we need to meet with the child care providers and really come up with a process, a streamlined process that makes sense. I think our WAC is confusing, that we need to totally rewrite it and so that it definitely makes sense moving forward. So just know that we're meeting with it. We already met internally and are committed to this. And our next step is to reach out to the provider communities to help us as well.
Right, thank you so much, Ruben. Allison. Back to you. What is the planned percentage increase to Working Connections Childcare, WCCC, for the biennium budget?
So there were 3 questions on here that were specific to implementation of Working Connections and merit pieces in Nicole's shop. So I'm actually going to turn them to Nicole as they're largely programmatic decisions.
Thanks, Allison, and thanks, team. And so I have a large answer to this and then some broken down answers to this. So if we think about the percentage increase to Working Connections overall, we would be taking into consideration the rate increases for childcare subsidy. We would be taking into consideration the increase in income eligibility. And then we would also take into consideration the CCDF decision packages around enrollment and prospective-based pay. And so when you look at all 3 of those things, it's about a 44% increase to the Working Connections budget. Those 3 items together are almost $1 billion just for those 3 items. If you were asking just about what is the average rate increase that a provider would receive, it's about a 27% increase if we were to go to the 85th percentile of the 2024 market rate survey. When we look at increasing income eligibility, we would see an increase in our caseload of about 25%. So we'd be serving about 25% more families. And then, as I said, the CCDF requirements, it's a 4.7% increase in the budget to implement the new Child Care Development Fund requirements. And then we would also be looking at adding 1 month of eligibility for approximately 15,000 or 45% of the family. So depending upon how you slice it, there are all kinds of ways to look at the percent increases in budget. But I would say overall, with all of our decision packages, it's about a 44% increase to the Working Connections budget.
All right, thank you. And I'm assuming, Allison, you're referring to questions 8 and 9 as well for Nicole?
We did not have numbers on ours. We got bullet points, but it was those 3 in a row. So if that was 7, yes, that would be 8 and 9.
All right, thank you. All right, so Nicole, you're have a follow-up questions about Working Connection childcare increases. Instead of budgeting for only Working Connection childcare increases, please share why funds cannot go directly to providers, similar to merit reimbursement to individual educators or EA grants directly to providers.
So I appreciate the question. And as we put forward our decision packages, what we really focused on was what was in the Fair Start for Kids Act and what was considered a maintenance level request. As I shared, those requests are over $1 billion+ alone. I think if providers were interested in thinking about how additional funds would go out, like stabilization grants did or something like that, we would need to have, at this point, we would need to be directed to do that because our focus really has been on what is in law. I want to acknowledge that even as we put all of those requests out there and I talk about $1 billion, that it is still not enough. It gets us somewhat close to the cost of care, but we recognize, and this is tied to some of the other questions in there, that one, the asks that we have are going to providers that are accepting subsidy. They're not going to all. There are some things that can go to all providers, such as complex needs funds and equity grants. We would just need to have more money in the system to get money to all providers, and our focus was on what was in law. I think we have an even more challenging environment in front of us given our current budget situation.
All right, thank you very much for that answer, Nicole. I do want to remind community members that if you hear something, you have a follow-up question, please feel free to drop it in the chat and we'll address it at the end if we have time, or else it'll definitely be in the feedback loop. All right, so Nicole, the next question is, what is DCYF planning to do to financially assist all providers across the state during the next biennium, not just those who receive subsidized children?
And so one of the things I want to note, and which is tied to this question above and tied to this one as well, is that in the early learning space, I would say we are what is called heavily provisoed. So the funds are given to the department with line items around what those funds are supposed to go for. So it's not like we get a bucket of money and we can then say within that bucket, here's where we think the dollars should go. And so much of that funding really is tied to our childcare subsidy, our family eligibility for subsidy, our providers accepting subsidy when you think about early achievers and some of those other pieces. And so our way to financially assist all providers is somewhat limited. Providers can access complex needs funds, equity grants, and I recognize that we get way more requests than we have funding for in those spaces. This is why when we started at the beginning, we really see increased subsidy rates and continued increase in family eligibility as our way to be able to reach as many providers as possible with funding. But right now, we don't have a mechanism or funding by which to do that. And Allison, I don't know if there's anything else you want to add to that. And the thing I would note is as we see the number of providers increasing, we are also seeing, I think we have over 6,000 licensed childcare providers right now. And the last time I checked, we had over 4,000 or so of those providers who were serving families who are receiving subsidy. So subsidy really is that mechanism that the department has to financially support providers right now. So the access and living wage work is really, really important. And the cost of quality care work is important.
All right, Allison, the next question is for you. How will the department support the field in obtaining health and retirement benefits for educators, similar to what was offered in a prior session for medical?
Yeah, this is another one, Lois. I'll turn to Nicole, as I think this is most directly nexus with the cost of quality care work. At this time, DCYF nor the Health Benefits Exchange, which was actually the state agency that implemented the healthcare premiums proviso, neither agency, to my knowledge, DCYF for sure, but Health Benefits Exchange put forward asks to continue that, as they discovered, and we can follow up with the exact data. Most providers who accessed that zero cost premium through the childcare premium assistance that HBE offered were eligible for other existing healthcare insurance reductions and subsidies that existed when Cascadia Care came online and some other pieces. So HBA was successful in transitioning the vast majority of providers who were accessing that zero cost healthcare premium to another subsidized healthcare plan. And the continuation of that has not previously been funded by the legislature. DCYF did not put forward an ask to restart that work, nor did HBE to my knowledge. I think the pathway here to increase rates and resources, dollars going to providers that the legislature has really doubled down on, that advocate groups have been advocating for a number of years, and the agency has been working hard on is the cost of quality work and pivoting from the sort of market-based methodology to the cost of quality. I don't know, Nicole, if you have things to add there.
You, I think, said it all. The one thing that we can do, and I know Amy's going to do this, is the Health Benefits Exchange still has the navigators who at no cost are helping providers identify a healthcare plan and sign up for coverage through Washington Health Plan Finder, and they're helping applicants through the application and enrollment process from start to finish, and we'll put that information in the chat. And then for folks who worked on the cost of quality care work, that did include amounts to cover retirement and health care. That was part of what the provider group recommended. And then the access and living wage work asks us to contemplate that as well. The other thing I would just note is that, licensed family home providers bargain healthcare through 925, but that also does not cover all providers.
All right, thank you very much. And thank you, Amy, for dropping that in the chat. Ruben, this next question is for you. How can DCYF best equip, oh, my poor timers. How can DCYF best equip and train licensors to work with providers as a supportive team instead of a relationship that is more punitive, violation-based? Providers should not be afraid of their licensor.
Yeah, and I agree, Lois. Providers should not be afraid of the licensors. This is not the culture we want in DCYF. This is not the culture that I want to create in the licensing division as folks do regulatory work. We are continuing to work, review, and train our childcare licensing staff on presumed compliance and a strength-based approach to childcare licensing. That is an ongoing effort. I've met with my training team to deliver this training, as well as offer continued resources and communications to my licensing leadership, as that is my expectation. We have also will be inviting providers to be a part of this staff training as well as panel participants, and supporting this important approach to our licensors. You've heard me say this before, we've had a turnover in licensors, especially during the pandemic. But what I've learned in this last year in our in-person childcare forum meetings, that we overregulate. And that's something that, as the assistant secretary of this division, I'm addressing with the childcare leadership team. And we need to change that approach. We also are in the first quarter of 2025. We'll be having our survey through WA Compass. After an inspection, providers will have the opportunity to fill out a survey to see how their experience went. And we'll be using that survey as a quality assurance piece to our licensing team. So we are working on it. That again, that's not the culture we want to portray, as I do not think providers should be afraid of licensors. At the same time, as many folks have heard me say, there are times where we do have to take licensing action on the WACs, and but we need to do it in a way that is respectful and professional, and ensure that we are providing that technical assistance.
All right, thank you, Ruben. And that follows up with this question. What is the plan to review regulations to provide some relief?
Yeah, we're looking at some right now. I mentioned about the staff qualifications. We will definitely be reviewing that one. We do have a handful of WACs that we will be revising and amending in 2025. What I heard also in the child care forum meetings, that our child care providers are not getting enough information when our WACs are open for amendment. So we're looking at how DCYF can improve in our communication when our rules are open for feedback, and just trying to think of creative ways, whether that's in the early learning newsletter, constant emails and reminders when rules are open. But in 2025, we will be opening up our chapter and looking at several of our WACs, and we'll make sure the provider community is aware of that, and can provide feedback through that process.
All right, you have a little bit more time. Do you want to add anything else, Ruben? Are you good?
I'm good, Lois, unless there's questions in the chat, I can.
All right, well, we'll come back to those in just a minute. We
Okay.
have 2 more questions. Both are for Nicole. Nicole, what is the possibility for the public to give DCYF feedback via a button on the website or a QR code?
Yeah, thanks for that question, Lois. And I had questions about this question, and I think that's really about for our communications team, and it would be helpful to know, I guess, feedback about what, because I know that the licensors are also doing some surveys. So yeah, I would love to know a little bit more here about what you all would hope to accomplish.
Well, that is the question. I don't want to speculate as to what the person who asked it, what they were looking for, but I think we're going to have some time so we can open it up. So if the person who submitted that question is here, please feel free to clarify as we move to that. And now we'll move to our final question, which is also for you, Nicole, and I think one of our most important ones. What is the best way for parent voice to be heard?
Yeah, and I think this is a great question, and I have some thoughts, and I think this is a place where I would also put this back on. I was curious about what you all would think about this as well. You know, we have our parent advisory group in state-funded pre-K. We also do a parent survey. But I would be curious, what are some ways in which you all think we should be engaging families? I think it is another place where we engage families and get some feedback is through the early achievers process. There is a piece in which we're connecting with families about their experience with their provider and with early achievers. I think, again, I would say, what are some other ways that we might engage with families from your perspective? And I see Deanne, I know there's the Family Resource Center. The other thing that we utilize aside from our parent advisory group is we have done some surveying of our families who are calling in through the Family Contact Center for childcare subsidy eligibility around you know, if they were determined eligible but weren't accessing care, why that was or might not be happening. So those are some of the strategies that we have utilized, but we would really be open to feedback and any ideas that you all have about some other ways that we could do this in a way that meets families where they're at. And I want to acknowledge that I'm talking from the early learning division perspective. That there are other divisions in the agency that are engaging families in a variety of ways as well.
All right, thank you very much to our panel. I am going to turn to the questions that are already in the chat and ask folk if they want to actually ask their question live. So we'll go up to Veronica. Veronica, I'm going to read your question, and then if you need to clarify, please do. What can be done for providers seeking special needs rates as reviewers are requesting different things, prolonging approval, and providers are staying stuck, not knowing what they want to see? Is there an informational sheet, or can something be done so that this doesn't keep happening?
And I am happy to take that back to Jason. I know I've talked with some providers about special needs rates, and sometimes they didn't know that there was information on the website. And so I am happy to take that back and see if there is a one pager or something that we can put together that simplifies the information on the website. I know we've tried to streamline the review process, but are still hearing that there are some challenges. And I also want to acknowledge that it's the family's right to ask for the special needs rate, which I know has been sometimes confusing and frustrating for providers, because the provider is sometimes saying, but I know I really need some support for this care, to care for this child in my care. But there is a family component to this, because that special needs rate is tied to the family eligibility. So I will, one, follow up with Jason. Two, see if we have a one pager, if there's a way we can streamline some of the information on the website.
All right, thank
Um,
you.
I would like to add to that. So I'm not referring to us, and I'm saying us because there's quite a bit that are going through this challenge. It's the review panel. It consists of us writing our area and then having it throwing, back to us, like, we need minutes. We need to know exactly what you're doing minutes wise, extremely detailed, where other reviewers, will review the special needs rate request and approve at a higher rate. There's extremely challenging, supportive needs for some children, and these are the ones that keep coming back. And I'm gonna put myself in this place. And while there's this huge need, and I'm over here trying to talk to them, there's a biting going on that could have been avoided had they are not being so stringent in stuff that we don't even know. And I think there should be a one pager. What is it that you guys expect us to write? For someone that's on constant high alert, and educators that sometimes are not able to go in and write those things. They're seeking intense information when they have information on the child from prior or doctors or parents. And it's very uncomfortable because it's a conversation that's going around where we feel that we're mandated, or we're supposed to write down that we're a zero, we're
So,
not going to
Veronica,
expel.
please
we're not gonna-
excuse me for, I want to be able to get to some other questions, and what
Well,
you're.
I'm sorry, I'm just trying to be specific. The need is something that states exactly what it is, that runs straight across, so that we're not having to expel children, but then DCYF doesn't want us to. We need that support from you guys.
So I want to acknowledge everything you've said, and I hear you stating that there are some perceived inconsistencies in the process. Jason has put a link in the chat. I also want to acknowledge, as we continue to streamline things, it requires more investment. And so I think if there's one thing that you hear me say today, part of it is we understand the need that is out there and the investment that is needed. And we have done our best as an agency to make some foundational asks. And we know that more is needed to support childcare. So please know that we hear that. And as we make changes, it will take continued investment. And I think that's why it's so great that you all can come together as provider supports and the Early Learning Advisory Council and really think about and talk about what are the things that you all as providers want to be advocating for in some of those pieces as well. So thank you for sharing your experience.
Thank you.
Yeah.
And if someone can contact me, that would be great.
All right, thank you, Veronica. So we're going to go on to the next question. And thank you, Jason, for dropping that information in the chat. And maybe Veronica, you can reach out to Jason so the two of you can connect if you want to exchange through private message. The next question is, the cost of care work and living wage work could be important, but how will it differ from the work of the compensation technical work group? That work did not result in action. What's different this time?
Yeah, I'm happy to start answering this, and this kind of goes back to some of what I just said as well, is that this is going to take legislative investment in order to move the cost of quality care work forward. We've really tried as an agency to make the connections between the 2024 market rate survey and why that cost of quality care is important. And this just takes additional investment. And so this is a place where, as you all are thinking about what are the things you want your legislators and others to invest in, this is a great thing to be thinking about. And we also have, in some respects, the foundation of at least having the market rate survey and law, which is also really important. And I'm going to let Allison weigh in here.
I think, yeah, just really briefly, I think a couple other key changes that provide me hope and optimism as someone who's been in and around this space for many a year or decades, is the Fed's shift from market rate to cost of quality. So the compensation technical work group was a work group that came up with recommendations. There's some intentional language changes in the law in state statute related to cost of quality that directs an implementation plan, for example, that requires we submit funding proposals rooted in that, right? So you see decision packages reflective of the true cost of quality where you didn't see sort of meat on the bone, if you will, around some of those compensation technical work groups, although I think some of that work helped build. I think the other big change is the shift at the federal level that allows states to use cost of quality as their methodology. We didn't have that tool, and the reality is a lot of our early learning resource comes from child care development block grant dollars. And so that helps add oomph, for lack of a more articulate word, to the proposal and to the need for the shift. So those are a few reasons why I'm hopeful this will yield a different fruit.
All right, thank you. And I see that Allison, you answered Susan's question in real time. So for those of you, I'll point you to the chat. And then move on to the next one that we can answer. Ruben, you mentioned that providers would be invited to the process around education as well as reducing the licensing requirements. You said a group. And so the question from Julie is, you mentioned providers will be invited. Will that be provider supports?
Yeah, not sure, Lois. I mean, I think anyone that is willing to participate in these panels would be great. So we will definitely start with provider supports to see if we have any volunteers, and then may reach out to other providers as well. So we haven't really decided how that process is going to work.
All right. And then there's also another question about center or home-based care. Where can we see the data on increase of providers and content about center home-based? And Allison answered that there is a monthly data dashboard produced and available online. Allison, is it possible for you to drop that link, or maybe Amy can in the chat? That would be helpful.
One of us will get it. If I was technology sophisticated today, Lois, I could, but I'm afraid if I go to that screen, I'll lose all of this.
All right, there are some comments about Washington State being one of the top 6 states with the most stringent and highest volume of regulation. So glad to hear that there'll be some work. The next question is, and Julie, I'm going to ask you to briefly just clarify this question in real time. Who will receive the survey results, and has the survey been changed to allow general comments from a provider?
Oh, thanks. Well, Travis had mentioned that there used to be a survey, and I asked who received the survey results, and he didn't know. And so I'm wondering, with this new survey, if a provider fills it out and returns it, who will receive it? Who will compile the data and do something with it?
Yeah, so to answer your question, Julie, so every provider after a monitoring visit will get a survey of the experience. Questions I think there's like seven or eight questions, and that information will go to my quality assurance and continuous quality improvement headquarters team to review. They will spit out a report every quarter of what that looks like and areas of improvement. And I can also share that data in provider supports and ELAC. I also want to mention if there's a survey that is concerning their experience, that will be addressed right away by the administrator.
Great,
All
thank you.
right, thank you, Ruben. And thank you, Julie, for clarifying. Our next question, we might have time for two more. Because if I remember, I think our panel has a hard stop at 10. All right. What can be done for providers? And this kind of goes back into the special needs question. What can be done for providers seeking additional special needs rates when the state will prolong the process of approval or denial? And providers are feeling stuck with paying an additional employee without the additional pay for the one-to-one support for the special needs child.
So Jason has put the link on in the chat to the process. I believe we have a time frame by which we are supposed to be approving all of those pieces. And Jason, I don't know if you want to come off mute and speak to that. I think we do not backdate special needs rates that I am aware of, but Jason, I'll give you a moment here if there's anything else you want to share.
Yeah, sure. Just to clarify, we'll backdate special needs rates back to the request of the special needs rate. And so as long as the family is approved special needs, we'll backdate that. And the last thing I'll add is, and we'll make sure this is spelled out on our webpage a little bit clearer. The special needs rate is really a determination based on the amount of time that the provider is giving the additional needs. And that's why the review panel, when we're looking at a level 2 special needs rate, is getting into the minutes. Because if we're looking at a 10-hour day, we need to know how much of that day is used doing the additional care. And that's where the additional amounts come in. And so that's why we get specific, and we'll make sure that's called out and that's important.
I think the thing I would note is that, as Jason said, we'll backdate to the date of the application. And we are working to approve those as possible. And I just want to acknowledge that not everything will get approved. And so I think there's a balance there as a provider, as you're thinking about what the additional care that you're providing for that child.
Thank you. There is a question, I think that's specific from Shailene. Shailene, if you would be so kind as to put your email address in the chat for Ruben, I think this might be one that you can address. I am going to skip to Janelle only because the question about feedback was hers. And she said, basically, how do we, anyone with contact with the department, foster childcare, people facing investigations, how do we provide feedback? For example, she said her dentist wants to know, how do we do text after every visit? The department is hard to give feedback to in general. There are many stories about situations that need to be redressed regarding how people are treated by DCYF. So how can people provide that type of feedback if they are having, whether it's praise or if it's wanting to share challenges with DCYF staff?
I certainly think this warrants a longer than 60-second answer, and I'm looking at the time, but I'm happy to start. I think Ruben talked about some of the improvements on the licensing side. I'll just acknowledge there is not consistent, easy to access ways to provide sort of real-time feedback from a customer service perspective for external folks, clients for DCYF. I think that's an area of growth. I think it's a bit of both what role the Office of Public Affairs plays in sort of creating some easy, accessible ways for parents, providers, clients to do that, as well as then how do we use that feedback and what do we do with that? So I definitely hear the question, appreciate the question, and I definitely think more conversation is warranted. I will note that if there are specific questions related to the child welfare side, but really any part of DCYF. The constituent relations team is available to hear, to get feedback, hear complaints, look into cases, also praise and pass that along. So that's one team that is not connected to any one program or division and is trained. It's a mighty team of 3, but they're trained to sort of be responsive to that interaction across the DCYF continuum. So I'll follow up with the community engagement team and make sure you all have that contact information, email and phone number.
And if I could just add, I also encourage providers to reach out to their licensor supervisor and provide feedback, whether it's positive or concerns. We talked about the childcare licensing survey that will be implemented first quarter 2025. As far as CPS investigations within my division, we also have a survey that we send out at the end of the investigation with the findings letter that providers can also provide feedback on there as well.
All right, thank you both. And there is in the, so folk can scroll through, Emily Morgan just dropped in a phone number for an email for constituent relations. So that may be a place for now until this is more formalized. So I want to thank our panel. It is 10:02 for giving us, by the time I wrap this up, 3 extra minutes. It has been a pleasure hosting this today. We thank you 3 for being here. We know it's a few days back after a long holiday weekend. It's good to see you all. It's been a pleasure working with you as co-chair, and look forward to being able to continue our relationship in a different role.
Yeah, thank you, Lois. I would just echo huge appreciation for you and Enrique's tenure in the roles on behalf of Nicole, Rubin, and I, and all of us. So it's bittersweet and happy to be here this morning. Look forward to more conversation with you all.
All right. Thank you, guys. Thank you again for being here. Dave, I'm going to turn the agenda over to you.
Thank you, Lois. And before we move on to the next section, we do have a couple of minutes. I know that those were a lot of great questions, but there were probably some additional questions that maybe weren't answered or that you thought of during the time that we just had with our panel. And so in the chat, Jessica has just put in the reflection survey for this section of the meeting. If you can click on that link, please provide any additional questions, follow-ups, things that kind of popped into your head during the last hour, because it's going to be important to note that anything that maybe didn't get answered today or clarifications that might be needed will be provided using the feedback loop. So let's take 2 or 3 minutes for people just to kind of click on that, add in a thought or a question, and then at 10:06 we will move on to our next section. So again, Jessica just put it into the chat at 10:02 if you're looking in your chat feed, the reflection survey for this question. I also want to thank Lois for doing such a wonderful job facilitating the questions that came in from all of you. It was great to be able to have that hour with them and to be able to go through the 16 questions that they had, plus more in the chat. And so thank you, Lois, for doing a great job of getting getting through all those questions and really allowing us to be able to have good time with that panel. So again, just a couple minutes for folks to fill out the reflection survey, and at 10:06 we will move on to our next section. Okay, thank you for taking that time to put in additional questions. And if I remember correctly, that reflection survey will stay open. And so if you are still typing or think of an additional question, we can continue to put those items into that survey. So now we are going to move to a review of the feedback loop and reviewing of the state agency and regional coalition updates. Typically, we do this right away at the very beginning of the meeting, but because of the timing that we had today with our panel, we did move it to this section. I do want to make a note that one of the things that we normally do during this time is also reviewing the meeting minutes. However, we will not review the October meeting minutes today for each of the groups because we have both ELAC and provider supports here. But each group will review your October minutes at your respective meetings coming up in the new year. So that's going to be January 22nd for the provider supports and February 4th for ELAC. And so to start this section, Jessica has just put in both the PDF and the link for the feedback loop. And so we're going to pause for 1 minute to read through that feedback loop. And then after that minute, we will open it up to any questions or clarifications. So right now in the chat, click on that. The PDF is the Spanish translation of the feedback loop, and the link is the English version of the feedback loop. So 1 minute here, and then we will ask for questions or for clarifications. All right, as people did their review of that feedback loop, I haven't seen any questions or clarifications coming through in the chat. But if someone does have a question or a clarification of anything in the feedback loop, you can please feel free to come off mute to ask that question, or feel free to raise your hand as well. Right, seeing that there is none at this moment, and we'll give you another chance before we leave this section of the meeting. Our next review is going to be our state agency, partner, and regional coalition updates. So again, I'm going to give you a minute to read through this document. Both of these documents, also as a reminder, come out before each meeting in the pre-meeting email. But Jessica has put in both the link for this document in English and then the PDF in Spanish. And just one note, we will specifically share more about the DCYF updates a little later on. And so just keep that in mind as you're reading this particular document. So we'll give another minute here to read through this, and then we'll come back to see if there's any questions or clarifications needed.
And I just wanted to jump in to let you know that we did receive some additional written updates to share after we sent out the prep email. So Yeah, Jessica is throwing them in the chat, so there's just a little bit of additional written updates were not previously shared.
Thank you, Aaron. Since we got that new information, let's wait one more minute and then we will ask for any questions or clarifications. All right, thank you everyone for taking the time to read through those documents. Before we move on, are there any questions for those updates and for the additional written updates that that Jessica provided in the chat? And Yolanda, I saw your note in the chat. I think that that's a question that was related to our panel. So if you don't mind, I'm gonna copy and paste that question and put it in the reflection survey. Does that work for you? All right, any other questions or clarifications off the documents that were provided? All right, seeing that there are none, I am going to pass the baton over to Enrica, who is going to introduce our next section of our meeting today. Enrica.
Great, thank you, Dave. So what I'm going to do now is I'd like to introduce DCYF's Community Engagement Manager, Marlene White. Marlene is here to provide an update as well as to gather some input in regards to the vacancies that we have currently on the ELAC Executive Committee. So Marlene, are you great? I see you.
Hi, thank you, Enrica. Good morning, everyone, and thanks for joining us today. I just have a really quick updates. They're definitely not going to take 15 minutes, so let me get through them. I just have actually 3 updates around the regional advisor representative selection. The other one is about the executive committee election. And the third update, I'm just going to put a plug in for the FSK report development. So for the regional advisor representative role, right now the regional coalitions are reviewing candidates to fill Enrica's seat on ELAC, and a decision is expected to come out during the week of December 9th. So once we hear back from them, we will let ELAC members know who the representative will be for that selection. A quick update on the executive committee election process. One ELAC member has expressed interest in the open seat, but unfortunately was not able to make it in today. So we're actually not going to be doing a formal voting process. We're going to delay it until the next ELAC meeting. But this is kind of exciting because there's actually 2 vacancies on the executive committee. So this is just a plug. If you're interested in taking a seat on the executive committee, I would definitely encourage you to apply. It's a great opportunity to serve. And if you're passionate about making a difference, if you want to learn more, definitely reach out to us. And we'd love to hear from you, or if you have questions about what it takes to serve, yeah, please reach out. So stay
Okay,
tuned.
Marlene?
Mhm.
Sorry to interrupt. I'm thinking maybe before you move beyond that, I know that we had reached out during the last ELAC meeting to sort of check in to see if there were folks interested. And I didn't know if it might make sense just to check in the space today, just to see if there was anyone ready actually to share their interest and to share why they would like to be part of the executive committee.
Yeah, well, from the CE team, there's been only one person who has contacted us, and they weren't able to make it today. So formally, we don't have anyone. However, if there is anyone interested, definitely come off mute and let us know, and we'd love to hear from you.
So, for those, I know it's been a while since we've done this process, but usually what occurs is that we'll ask ELAC members if anyone is interested in serving in the role, and this gives you a chance to just share out now at the meeting that if you're interested, and then to share why. And then we move into a session where that person would normally, if we were in person, would leave the room, and we would then vote on accepting that person's nomination. So if there is anyone who might be interested, we have time to be able to go through that process.
Lois, would you mind explaining like the time commitment and what the actual job is? And do those roles have any, I'm gonna use the term authority for lack of a better way of explaining, like influence, or what would be the teeth behind it?
Well, as ELAC co-chairs, as well as the regional representative, we work with the community engagement or CE team to plan the agendas and go through the different topics, share out whether different topics, how much time is needed, whether or not the topic needs to have time for breakout rooms. We always, Enrica and I, since we've been serving, and Enrica, feel free to jump in, have always pushed, even though it has not always happened, for materials to be sent out early so that people have time to review it. And sometimes the CE team is bound by when DCYF staff, who wear many hats, are able to share materials with them. We also ask that when we have presentations, that presenters actually come with a question for the group, as opposed to just sharing reports. Because if it's a report, then we ask that it be placed in the feedback loop so people can go there. So there is that time to collaborate with DCYF staff, as well as Nicole Rose and Amy Russell usually come to our planning meetings at some point to be able to talk about any topics that are emerging that they may need feedback from based on whatever's happening internally in the department. Enrica, can you add anything I might have missed?
Yes, yeah. So, Lois did mention the planning meetings, and those planning meetings are sort of tied directly to the executive committee meetings. Typically, there are 3 meetings that take place in between ELAC sessions. Sometimes there are some additional meetings that we are called to attend if things come up related to coalition, related to ELAC meetings that we need to attend to. So that's important to be aware of, even though there are generally 3. It is not uncommon for Lois and I to be participating in some other activities as we're preparing for these ELAC sessions. I noticed there was a question in the chat, I think from Julie, and yes, for the co-chairs, you do need to be an ELAC member. So the executive committee does consist of 3 people. There's 1 regional advisor representative. That individual is appointed by the regional advisors. Then there are 2, there are ELAC co-chairs, and those ELAC co-chairs are ELAC members that do get appointed through a voting process that Lois described.
Thank you.
Yeah, thank you. Thank you for your questions. Are there other questions related to this process, or anyone after hearing all of this interested in raising their hand and throwing their name in for consideration?
There's nothing like being
Great.
thrown in this spot in a group setting this way. I actually would be really interested, but I have a lot of questions still, just because I feel like with ELAC, I've kind of come in and come out, in and out in different spaces. And so I wouldn't want to make a commitment that I didn't fully understand, but definitely getting involved and having an opportunity to lead discussions in groups, and the work that you all are doing is valuable. And so I don't feel brave enough to say yes until I did more research on what you're looking for, which is why I asked the question about it.
Yeah, no, I think that's great. And what we can do right now, Darlene, is we'll take names, and Marlene, I know, is taking names, and we can make sure, I know these, the minutes will capture this discussion, but if there are additional questions, we can take those questions and make sure to send something out with additional information about the roles.
Perfect. Thank you so much.
You're welcome.
And Enrica, I'm thinking, since we have some time, we're way ahead of schedule. We could answer some questions in real time if you're open to that. I know I'm putting both of us on the spot, but I think that we might be able to, for those who are on the cusp of saying yes, maybe we can push you over a little bit.
We can definitely, yes, we can definitely do our best to address some questions right now in real time. And, if we're not able to address those, we'll definitely follow up. So maybe we'll just turn it over to everyone here. What additional questions might you have as it relates to those roles?
Well, people are thinking of their questions. I just want to state that in the chat, if there were additional questions that you wanted the panel to answer, or if you had any clarifications that were needed, if you can put those in the chat. I saw in the reflection survey, there isn't like an easy way to continue to add those in. So instead, if you put them in the chat, I'll gather all those together, and then I can send them to the right folks as well. So. And you guys got a question in the chat about what you asked. What are the most important aspects of this position? What kind of background would be best for the leadership position?
Great question. As you can see, Lois and I are both thinking.
Well, I would, Enrique, I'll start, I think the biggest thing is being willing to work collaboratively with the different groups that are partners with the Early Learning Advisory Council. So that would be, of course, the CE team at DCYF, as well as leadership, as we meet with, again, with Nicole and Amy, as well as Matt Judge, and just different, you'll meet with different members of ELAC. Being able to be present is also important. Things change. There's a lot of messaging and texting and different things that happen behind the scenes. So being able to facilitate as well as keep track of those changes that may need to happen. Like now, where we're a little bit ahead of schedule, but finding a way to utilize the time that will hopefully be viewed as helpful for and supportive of the community. Enrico.
I can add a few, yeah, that's okay,
Yeah,
I can
and
add
then
a
I'll
few.
come back.
Yes, yes, we can go back and forth, sort of thinking this through. Actually, there were a couple of things that I was thinking about just when I reflect on what Lois and I have been doing. I think, you know, being able to be flexible and in some cases being persistent. You sort of heard Lois give the example of, you know, we're really trying to make sure information gets out to folks in, you know, in a timely fashion, and sometimes just being persistent with those requests. Also, I think about there are, I would say, a fair amount of times where we need to act pretty quickly. You know, questions might come to us through email, and they're requiring responses fairly quickly in order to help inform the next ELAC meeting. So I do think that's maybe something to think about as you're considering this role. In terms of what kind of background would be best for this leadership position, I personally feel that, all ELAC members and RAs, we're in these roles and attending these meetings because each and every one of us have a passion for early learning. And to me, I think that is the requirement for the role. I think that helps, that best situates you to serve in this capacity. It's just your passion and your enthusiasm and your drive for early learning.
And being willing to ask the tough questions. That's also really important, and sometimes having to push back on different things that are proposed, as well as being, as we said before, being willing to also remind people too, because you'll have, as co-chairs, you'll have those people who are okay with everything that ELAC, that DCYF, excuse me, does, and those constituents who have an issue with everything that DCYF does, and being able to balance that and bring both sides forward so that DCYF can make informed decisions around the work that it's doing.
So there's typically a lot of representation from Seattle or King County. Are you hoping to get something that's more statewide on, on Eastern Washington or in the middle of the state? Like, do you have a goal in mind?
Well, when we first,
go ahead,
Lois. Go ahead, Enrique.
What I was doing with reflecting historically. So I think this just sort of happened, where it just happens to be that Lois is from King County. I happen to be the regional advisors from King County. In the past, we definitely have had a balance on the executive committee in terms of Eastern Washington representation and West Side representation. So just know, and that is something that we definitely do take a look at.
Yeah, and Darlene, the key too is, again, whoever the person who is going to be co-chair, the co-chairs must be current ELAC members that are in a seat, as well as on ELAC for at least 6 months. And the reason being is that gives a person at least 2 meetings, and maybe some of the report planning meetings that ELAC does, because the ELAC, we are required, and that is the other thing, to provide a report to the legislature every year. And so we have additional sessions around that as well.
Thank you.
Any other questions at this time? These are great questions.
Is this the time too where we ask if we've created any interest? Because
Oh, I say go for that question, Lois. That's great.
yeah, there's any interest, because we just want to remind everyone, these positions need to be filled, because if you want to have community voice involved in planning these meetings, then the CE team needs to hear from community members. And if the positions aren't filled, then CE will be responsible for planning the meetings, because Enrica and I cannot continue indefinitely in a transition role, transitory, role. So we're hoping that someone will step up, because we do need these roles filled. And even if you take it and you say, this isn't for me, at least you checked it out, saw what it was about.
And just to add to what Lois is saying, you are working as a team. So, and I think one reason why we're sort of emphasizing we really want to fill these roles, because by filling all the roles, then we'll have an executive committee that's a team of 3. You've noticed it's just been Lois and I for a long time. That's because a while back we lost our third member. That third member had to step away, and it's been hard to fill that third spot. But when I think about the executive team, I just want to emphasize that you're not doing this by yourself. You're doing this as a team. You're doing this with the support also of CE. So if you're hesitant there, or thinking that you're needing to take all this on yourself, no, you're part of a group that's working collaboratively.
Oh, there's 2 more questions. Can you share how they can become members? Marlene, that might be a question for you to answer. And thank you, Waylon. Thank you. Marlene, you want to take how they can become, the process for becoming an ELAC member, and how that happens, and the seats?
Well, that is a good question. And I know there was changes based on the law changes to FSKA and member recruitment. So I'm kind of looking at Erin here.
Yeah,
I
I
know
can jump
that.
in if you'd like.
Yeah, thank you.
So yes, like Marlene said, with the passage of FSKA, that impacted ELAC's membership requirements quite a bit. So it's pretty much dictated by the FSKA, where every seat is assigned to a specific role, and pretty much all the seats are assigned by appointing authority. So the big difference between that and how it was done pre-FSKA is we would have certain representation requirements and seats, but then we would kind of just do an open recruitment for those people and let people kind of self-select. But now we go through appointing authorities. So Marlene put the roster in the chat, so that will give you a good breakdown of what the requirements are. And so in reviewing all the required seats on ELAC, if you feel like you meet any of those requirements, if the seat is vacant or will become vacant, you can connect with the appointing authority for that seat. And not all of the seats are very black and white, straightforward necessarily. So if you're a little confused or if you're not sure who to reach out to, you can always contact the CE team directly and we can give you information on whatever specific seat you may be interested in. Oh,
Aaron,
and
I
Julie,
see okay, you saw it too.
just
the
saw
question.
Julie, yes. Thanks, Julie. So appointing authority is basically assigning the authority to select who will sit in that seat. It's assigning it to an outside agency that is not DCYF. So for the most part, they are either community organizations or other government agencies that are associated with whatever representation requirements are for that seat. So it's basically just the appointing authority is the entity that has the power to select who will sit in that seat. And there is attendance requirements, Susan. I'm trying to remember off the top of my head, but I believe it's your standing may be in question if you miss more than 2 consecutive meetings or a certain amount of meetings over a cumulative time frame. It is spelled out in the charter. I can pull that up momentarily.
That's, Aaron, I'm just asking because I'm looking at this roster and there are lots of names on here that I don't think I see often at all, or if ever.
Yes.
So what's the enforcement of that? And is there really a lot more vacancies really based on that?
That is a very good question and observation, Susan, one that we have wrestled with quite a bit. It's one of the unintended consequences of moving to an appointing authority model is our power is a little bit limited with that. But what we have been doing is if somebody is not meeting the attendance expectations, we will reach out to them directly and say, hey, like, is this something you're planning on doing? Or would you like to go ahead and have your appointing authority appoint somebody else? Give them an opportunity to kind of course correct. And then if it goes over the line, then we reach out to them again and include their appointing authority and request more immediate action. And
I think that's an important thing to address, because if there's anything like quorums or things of that nature, in order for action to happen, what is the impact on how much work can be done by the high number of absences on this thing? So I would encourage whoever is in this role or continue to actually make that a top priority, because it is concerning to me. Because I don't know what the quorum stuff is and I don't know what some of these other things are, but it just seems it could be a hamstrung process without greater participation. So thank you for your answer. I
totally agree.
Yeah.
Totally agree, Susan. And that is that was included in the FSKA recommendations this year. I expect it will continue to come up because that's what it would require. It would require a legislative fix. In order for us to really get our arms around it and get a little bit more authority in managing the roster. So that is something that the members have been aware of and working to address, and we fully support that. But I completely agree. It does add another layer of difficulty.
Okay, thank you so much.
Yeah, and if I can add to that, Aaron, Susan, that is something we have been talking about ever since the changes were made, and have presented that information to legislators as well as the DCYF leadership team. Unfortunately, we haven't had any movement with the legislators on changing that piece of the Fair Starts for Kids Act. But, you know, we are all constituents, so feel free to send emails and write your legislators and tell them how it is impacting our work. Enrica, I see you came off mute.
Oh, yes. No, I was just looking in the chat and I just wanted to make certain that there is not going to be any vote today. So someone was raising a concern that there was going to be a vote of someone who's not in attendance. There's no voting taking place today. So just wanted to make sure of that. I do see a hand raised though from Representative Mari Levitt.
Yes, good morning all, and thanks for your good conversation. I would say on a legislative fix, I would probably wait until the new administration for DCYF comes on board, whoever that's going to be, and engage in conversation. And it could be something for 2026 session with the 2025 budgets the way they are. I just don't see that becoming a priority for this upcoming session, in particular with a new leadership transition. So I would probably wait until 2026, but I would engage in early conversation with the new DCYF leadership team, and have that conversation of how can they strengthen ties and encourage participation and engagement on these efforts and why it matters as a starting place. And maybe it's something that we can invite the new DCYF leadership team to an upcoming meeting, you know, in February or March, to engage in conversation with them.
Thank you, Representative Levitt, for those great suggestions. Aaron, I'm just going to turn to you because I wasn't sure if you had anything to add to either questions that are coming up or.
Are there any outstanding questions I may have missed? I don't think I have anything to add to that last point, other than yes, it is a concern, and we're doing our best to work with what we have, but just being transparent, we don't have a lot as far as sway and control over that piece, but we are doing our best to tighten up our internal processes as much as possible to hopefully mitigate some of that.
Thank you, Aaron. I see we're getting close to our break time, but did just want to do one final check-in to see if there are any remaining questions or any questions that Lois or I or Aaron missed in the chat. The chat sometimes goes by so quickly that it's hard to catch everything.
And then Marlene, since this was your section, is there anything else you wanted to add?
Oh, thank you. Just really quickly, I wanted to put a plug in for the FSKA report, just an update. We're switching the timeline so we can have the recommendations for the report done by spring. And this is in the feedback loop documents, but I'm just going to share it in the chat really quick. If we've started drafting or just gathering initial insight and feedback on the 2024 recommendations to help us build the 2025. So here in the chat is a link to Padlet where we've put the 6 recommendations out. And if you have any comments or feedback, you're welcome to go in and add those to each section. And like I said, the feedback loop document has the instructions on how to do it. And the Spanish version has the recommendations and the translated version of the recommendations. So in the feedback loop document, the Spanish version is much longer because it has all the translations on it. But yeah, thank you. Oh, wait, one other plug. The next meeting, the next report development meeting is happening January 7th. I don't have it in front of me. Yes, January 7th. So we'll further refine the recommendations at that meeting and we'll continue working through that and hopefully have them done by spring. Thank you.
Great. Well, thank you, Marlene. And thank you everyone for the questions. Please keep those coming. You know, if you have additional questions, feel free to enter those either into the chat or into the reflection survey. Also, as a reminder, if if this conversation did spark your curiosity or interest in, you know, adding your name for consideration for ELAC Executive Committee, please reach out to Marlene and she'll take down your information. With that, it is 10:46 and we have a scheduled break. So if everyone can be back at 11 o'clock, then we'll move into our next agenda item. Okay. Thank you, everyone. Hi, everyone. It is 11 o'clock. We're going to go ahead and get started so we can stay on time. And just as a reminder, again, continue to keep your questions coming from our previous agenda items. You can use the reflection survey to enter, to make sure your questions are recorded. But what I'd like to do at this time is to introduce DCYF's Federal Initiatives and Collaboration, Senior Administrator Matt Judge, PDG Specialist Delta Rotter, and Workforce Supports Manager Gretchen Starr-Brunig. They are all here today to provide us with an update as well as to gather feedback on the preschool development grant supports for the birth to 5 workforce. So I will turn it over to Matt, Delta, and Gretchen.
Thanks, Enrica. Our roster is actually a little different than that. So I'll have everybody introduce themselves as they come on and do their pieces, but I'll be joined today by Delta Rotor, Michelle Roberts, and Kelly Heikala to discuss just a few of the projects in the Preschool Development Grant 2024 renewal. And these are based on the selections of ELAC and provider supports about the different projects that they wanted to hear about in specific. So we're just going to speak about those ones today. If you can advance the slides, I'll talk about our roadmap here or agenda for our discussion. Just to make sure we're all grounded in the bigger story here, we'll provide the briefest of backgrounds and contexts around the preschool development grant itself, just so you have that baseline, and then give you a summary of the 2024 iteration of that renewal grant under preschool development grant. And then, so Delta and I will do that. And then we'll turn it over to Michelle and then Kelly to go into specifics about some of the workforce supports projects and the curriculum project that are just pieces of the 2024 renewal grant. Within the workforce supports and curriculum projects, for each of those, there will be a feedback opportunity. And so we have 2 surveys, one for each of those categories. And I think the idea is to have some group discussion and then allow you all the opportunity to answer some of the questions or speak to the questions that speak to you in the survey. So that's what we have in store. I'll just pause for a moment to see if there are any questions about any of that. Okay, if you can advance the slide, we'll get right into it. At the highest level, the preschool development grant, this is a federal grant administered by HHS Early Childhood Department or Division that's available to states and territories. The idea here is it supports early childhood services for children birth to age 5, although it's really, going to support the entire system. These funds support a needs assessment, strategic planning. You may have heard of the Early Learning Coordination Plan. That is the strategic plan that Washington has undertaken through use of preschool development grant funds. These funds also support family engagement, work on quality improvement or quality recognition, workforce compensation and supports, and more recently, and I'm want to underscore recently, direct services for young children. And the reason I'm underscoring that is in prior conversations, you might have been hanging out with Tracy Kenny, the former PDG administrator, and she would talk about this grant as a systems building grant. That is still largely true, but with this most recent iteration, there is a little bit of a increasing emphasis on using funds for direct services, and I'll talk just a little bit about that in a few minutes. Next slide, please. Again, continuing with the overview, this is a competitive federal grant to states and territories designed to improve the early childhood system in those states and territories. It's to help us coordinate early care and education programs and services that are already existing in the state, according to our identified needs, again, through that needs assessment for each state. So I want to emphasize, because this question comes up quite frequently, that this is not a grant to providers, not that there's anything wrong with that, but just the way it's structured on the federal to state partnership level. Each state or territory has a lead agency designated for implementing the grant. In Washington State, that's Department of Children, Youth, and Families. And the projects that you're seeing here have evolved over the years of the PDG grant with some coordination with our stakeholders and tribal nations, including ELAC and provider supports. So many of the projects that we'll describe in a few minutes, and the ones that we're going to talk about in specific today, have really been built up over years of collaboration. So we're really excited about this new iteration of the grant. For the next slide, I'm going to turn it over to my colleague in the preschool development grant team, Delta Roeder, and she will talk about the history and some more details of this current iteration of the grant. And Delta, if you can introduce yourself with your title, because I didn't, that would be great. Thank you.
Absolutely. Thanks, Matt. Hi, everyone. I'm Delta Roeder. I use she, her, and they pronouns. I am the Preschool Development Grant Birth to 5 Integration Specialist here at DCYF. I am fortunate enough to have been a part of this grant from very early on. I was the second person hired on under the grant. At the time, we were told that it would be 1 year, and here we are. I'm going on 6 years of this grant. So really fortunate and really grateful to have been a part of this journey from pretty early on and gotten that I've been able to see how it's grown and changed over the years. So we were awarded our initial grant in 2018. That was a planning grant of $5.3 million. And as Matt mentioned, there is a needs assessment and strategic plan attached to this grant. My team's original focus were really those two items in the beginning, and we thought the needs assessment would be fairly quick. It was supposed to be a gathering of the original of already existing information out there, and we ended up spending quite a bit of time on that, thanks in a large part to ELAC, to you all, and the folks who were a part of this council at the time. We were encouraged to slow down and really go deep into communities as we did this process. So the process ended up taking over a year, which was the right call. The needs assessment is a very large document. And because of our pretty extensive work with communities, we were able to get a lot of really good qualitative data in there, which is quite frankly different than what a lot of other states did. many states were awarded this grant, and each state has chosen to do things a little bit differently. And in Washington, I think we stayed true to our values around doing things authentically with communities. And that carried over into the early learning coordination plan work, the strategic plan work. We worked a lot with you all again, and in early 2020, just before the pandemic, we were able to do a pretty intensive process over the course of 2 months to write the goals and strategies. So those goals and strategies were written by community members. And so, yeah, we then did the 2019 renewal grant. So that was just over 30 million over 3 years. And then into the 2022 planning grant, which we are just wrapping up. And now into what I very lovingly call the PDG R2D2, because I think it's hilarious. So our second renewal grant. Right now we have our first year of funding, and years 2 and 3 will be the same amounts again, pending congressional approval. This is not any different than our previous renewal grant. This is pretty standard. We don't expect any issues with that, and we just can't obligate any funds until we have that renewal year by year. It is a competitive grant, but since we have already competed and been awarded a renewal grant, we do not have to recompete for the for years 2 and 3. We just have to get that approval. Next slide, please. So the purpose and priorities of this grant are to build on the prior planning grant that we are wrapping up. So there isn't really anything new with the exception of one activity in this grant, because our direct instructions from HHS were to build on things that were already being done under the planning grant. The purpose of the planning grant was to inform how we would then do this renewal grant. So building on that grant, we want to maximize family participation and engagement in the state's mixed delivery system, support the early childhood workforce, and support early childhood and education program alignment and quality improvements. Let me see. And we want to ensure that underserved children and their families, including those in high poverty and rural communities, can access early childhood education services and support. So we have really focused in on some rural communities, tribal communities, and other communities that we know are often not a part of the conversation and not getting the supports that they need to thrive. Okay, I will pause there. Are there any questions? Okay. If anything comes up, please feel free to put it in the chat and I will respond as quickly as I can. And with that, I'll pass it back to Matt to give a high-level overview of all the activities in the grant.
Great, thanks. Apologies to the Spanish speakers. I did not select my interpretation earlier. Getting better at doing that, but obviously not all the way there yet. Hopefully you're hearing me in your language now. But this is a list of the projects and activities they fall under for the most recent grant that we were just awarded. These different activity numbers that you see outlined here, these are the, early childhood department's categories, not ours. So we've worked projects into those categories, again, as Delta was describing, to meet their criteria. Fortunately, all this work does build and support our system. Here's just the highest level overview of some of the projects, and I'll highlight the ones in particular that we're going to talk about today, especially. Activity 1 is about that needs assessment. They're asking that we do an update. Fortunately, we already did, so we get those points for free. We learned through that, though, that we have continuing challenges in inequity and disproportionate access, for some of our key success indicators in early care and education. So we have some wins recently with Fair Start for Kids Act and other things like that we want to leverage to address that issue. That's an ongoing challenge. Activity 2 possibly covers updating the early learning coordination plan. There is an impact network that formed around that plan that guides all the work around that plan. And so we will work with them on any potential updates to that plan. We did ask for some funds to support exploration of one of the plan's 5 outcome areas. So that's that second bullet there, impact for families work. We really want to use those PDG funds to really focus on that area. But of course, the network can choose its own focus as well. Activity 3, this is around that maximizing family engagement topic that Delta just mentioned. You may be familiar with Help Me Grow, a statewide referral system here in Washington. We want to strengthen that and its connection with Child Care Aware and its referral services. We want to integrate access to paid family medical leave in that work. And we want to make it more accessible for tribal nations by developing a pathway for them. You may be familiar with the Play and Learn initiative. That's a system where folks who are in, accessing TANF benefits in community service offices, for example, can access informal care while they do that. And then at the same time, potentially get access to developmental assessments and other resources. We want to expand that into a tribal community. So you see some real focus on tribal nations in some of this work. Activity 4 is one of them. We're going to explore that in detail today. There are really 5 sub-projects, or at least we were encouraged by the format of the application for the grant to think of them that way, even though they're interrelated. But we're talking about integrating a comprehensive pre-service training suite, developing resources on qualifications, a new workforce systems navigator role to help folks who are getting into the field, and starting to explore phased delivery of health and well-being supports for providers. Those are 4 projects within the Workforce Growth and Quality and Recognition team that you're going to hear about today. 5th project there is expanding our support for providers who are working with infants and toddlers by adding a specialist to that infant toddler specialist network. So we'll talk about all of those. Within activity 5 today, per your direction, we're just going to talk about this open source curriculum project. Kelly's going to help us through that. But we also have some work around expanding the pyramid model, supporting providers who are working with children with behaviors that adults might perceive as challenging. That's some critical work. We also want to integrate data so that we're leveraging that to improve our programs. I alluded to earlier a direct services component of this grant. That's here in activity number 6. Through this grant, we're receiving funds to expand Birth to 3 Earth ECAP, which you may know as early ECAP, by 75 slots. So a significant expansion just using these federal funds. Finally, there are a couple of bonus activities in this grant. You may have heard of the contracted slot pilot, 100 slots for children involved with child welfare, where fentanyl exposure is an element of the case. We want to expand or increase or support pay for providers and staff doing that work in that pilot. So we'll use a little bit of these funds to do that. And finally, we want to create a trauma-informed care, social emotional learning pathway that's closely connected to the pyramid model work that I talked about before, but was classified as a bonus activity for this application. So that is all the projects in this most recent iteration of the grant. Again, we will explore today all of the ones in activity 4 and just the open source curriculum one in activity 5. That was a lot. I'm out of breath, so I'll ask if there are any questions.
Hi, Matt. There are a few questions in the chat.
Thank you. So I see one saying, were culturally responsive curriculum or criteria included? I will let Kelly address that question in her portion around the curriculum topic. So more to come on that. Are these funds coming from the Department of Education? Glad you asked. I was asked the same question earlier on another topic. No, they are not. This is Health and Human Services and then the Early Childhood division of that agency. So if you're wondering about that proposal to eliminate Department of Education, as far as I know, that's no impact on its own to this grant. Oh, and Delta answered that one. Why is DCYF creating a brand new curriculum when so many well-established curriculums already exist? It seems that funding could be better spent. Well, I'm looking forward to that part of the conversation when Kelly walks us through the open curriculum piece. And same with Julie. Sorry, I can't address that, but you have Kelly. So no point in my talking to that one. So next we can talk about the workforce supports topic. Of course, this group is led by its members. So if you want to get into those questions around curriculum that I can't address, of course, that's your prerogative. So Enrique, if you want to kind of let me know the direction on that.
So, yes, welcome everyone. My name is Gretchen Starr-Brunig, and I'm delighted to co-present today in a new role, Workforce Supports Manager, and I'm re-entering this preschool development grant work with great vigor and enthusiasm. So I am co-presenting today with Michelle and Kelly on the activity 4. So we're doing the zoom into Matt's prior slide. All of the workforce supports are what we are going to discuss in this section. So this is the list of the supports that we will be talking about today. And as you will probably hear, this preschool development grant, as both Matt and Delta noted, we had some very strong foundations set in the planning grant and the initial grant that we're building on and honing in this renewal grant. So we're addressing the staffing shortage with both recruitment and retention approaches, and creating greater simplicity and more navigation support. So I will be talking about the first 3, and Michelle and Kelly will support with the last 2. So next slide, thank you. So this is the first of the 5 strategies, and as the providers enter the workforce, this strategy provides strong peer connection in a menu of supports to select those that each provider needs, provide tailored support. The first part of it is creating a cohort model to complete all of the pre-service requirements with a culturally and linguistically responsive delivery and language-specific startup training. There will be in-person and hybrid options, and the technical assistance and community support will cover related systems like stackable certificates, degrees, and credential completion in the colleges. In addition, the pre-service options that will be covered in this cohort are the merit account registration, health and safety training, CPR, first aid, bloodborne pathogens, everything that's required upon hiring will be covered with this, and is a very streamlined approach with funding for completion and lots of peer connections. Next slide, please. So the next project is developing a streamlined resource to assist with staff qualifications, to clearly communicate what those qualifications are. And this resource will be designed either for individual use, for those that have been part of the system and may be entering a new role, or with the support of the Career Navigator, which is the next project. So that career navigation will be the culturally and linguistically supportive service that helps providers at whatever stage they're in the field, whether it's entry or ongoing. So hopefully this resource will provide that technical assistance not only at workforce entry, but continuing. Next slide. And then the third related piece, as Matt indicated, they're all interrelated, is the career navigation. And so this will look like a more intensive version of the navigators that DCYF currently has, where this career navigation will help coordinate across a variety of supports whether it's scholarships or access to benefits or a variety of other things. We will be able to have holistic and culturally sustaining and comprehensive outreach, onboarding, and support, seeking a variety of career pathway options. So we hope that this last strategy will not only encourage new applicants coming into the field to navigate some pretty complicated staff qualifications with the support of that streamlined resource, but also help to guide those that are moving from role to role within the field. And with that, I'm going to pass the presentation to Michelle.
Hi, everyone. Thanks, Gretchen. So nice to be with you all today. And I was just noting in the chat a couple of questions about the cohort model, and anything that we don't answer in the chat, we can expand on as well. And part of that is because we have a good chunk of this time is really saved for your live questions, discussion, ideas, really turning to you all as thought partners and wanting to come through all of these activities because we're approaching it a way that they're all connected and they're all about supporting the workforce either at recruitment or in helping in like sustaining in the roles that folks may have. And so the goal is all of these activities work together, and all of these activities are intended to build into sort of like a suite of options that you can choose your own adventure, so to speak, where you can say, I need really light touch support. I know the information, I just need to be able to find the training and get my people registered. Or it may be like, I just want to send my person to this cohort model and have them get all of their training all at once, and someone will schedule it for us. So there's just a wide range there, or maybe there's some technical support that you want to access resources online, or you want to be able to talk to somebody live for a group of staff at your site. Really, though, the goal is to be super flexible, super responsive, and all based on the design and recommendations directly from providers. In our planning grant, we had a lot of touch points with providers in workforce surveys and focus groups to think about business supports and workforce supports, and using all of that plus things that we've collected over the years that led us to where we are to really get it right. Like we're here to really listen and take all of the great things that have already happened, and then also prune out the things that aren't helpful and try to make this as simple and as accessible as possible. And one of the great things that we're thinking about, in addition to some of these workforce supports that Gretchen talked about, is health and well-being supports. We've heard loud and clear multiple times that in addition to all of the increase in infant early childhood mental health consultation for children and families, providers themselves need health and well-being supports, whether that is actually like employee assistance program or navigating benefits, or if there's other sorts of supports that we might be thinking about. Our goal is to spend time with providers, taking the findings from our business supports, a landscape analysis during the planning grant, and develop a strategy, co-designing, testing the feasibility of different supports. Some of that will be pulling the ideas that came from that report, as well as brainstorming and thinking about other options that might work, and then come up with a shared cost model that we can continue to phase in implementation, potentially with additional funding as well, and like long-term in the future. So we're really thinking about how it's a full wraparound concept of support for providers, that when you enter the workforce, you're entering knowing that you have access to resources and information, and can work on your career pathway as you wish, and to what suits you, as well as get the mental health and well-being supports that we'll be thinking about as well. So with that, I'll go to the next slide and then we'll have some pause for further conversation. So what have we done so far? So we know that we're going to have multiple contractors that we'll be working with in some of this. Some of them were named in the grant, thinking about coordination of that pre-service suite of onboarding and staff qualifications, thinking about the live technical assistance that we want to be able to make accessible in communities. And not necessarily like we aren't here to deliver the technical assistance, right? We know we can have a lot of information, Merit inbox in our navigators have a wealth of information and are a great support to early learning providers. And we also know that right in community, there are lots of people that you can turn to for answers and information. We want to work in community with other partners, whether that be Childcare Aware, Imagine Institute, Voices of Tomorrow. There, I could name many more. And the goal will be to co-design and have a review of the resources that we're establishing, the responses, and the way that we provide the technical assistance in communities, the mental health supports. All of this is really intended to just building up of what Delta was saying earlier about listening to community and really trying to say, in what ways are you driving the supports you need? And, you know, I made the comment of like, you know, we could guess, and we know historically that has happened in the past where we maybe put a lot of information out for providers on our website, and then it may not be effective for everybody. And so we really want to listen and be able to design with all of you. And then really thinking about following the recommendations that we got from our planning grant. We met with many providers, well, not we specifically, we contracted to have many focus groups with providers to really gather insights related to business supports, related to staff qualifications, and being able to access and navigate the qualifications that folks need to have for their roles. And we're going to be able to build from that. Again, to Matt and Delta's point earlier, that this is all intended to continue to build on the great work that's been happening, and to be able to take things that we did in our planning grant in previous years and really think about the ways that we can continue to refine, continuously improve, and enhance the things that we're doing. And the other thing I'll say when we talk about community engagement is we really want to connect with you all today too. And as I was saying, the majority of our time is really intended to be able to speak with all of you and hear more from you. And so with that, I'm going to pause and have Kelly talk a little bit about the infant toddler supports, and then we'll come back and continue to go into some of our questions. And I'm tracking in the chat that I'll respond and then address them after Kelly has a chance to share.
Awesome, thank you. So I am Kelly Heikla. I am the QRS administrator here at DCYF, and I currently oversee the Early Achiever System for the state of Washington. And today I'm going to talk a little bit more about the workforce supports specifically targeted towards infants and toddlers that we'll be working on for this PDG grant. So one of the things that we are hoping, or we are going to do, excuse me, is the PDG grant will support the expansion of the Birth to 3 Quality Initiative. Sometimes you might have heard it as called the B3QI program, that is currently in assistance right now for infants and toddler educators in the family childcare homes and childcare centers, using filming interactions to nurture development. Educators work one-on-one with the B3QI trainer or coach in their setting to complete training and coaching in Find. So coaches film the educators one week and then review the films the next week, discussing the ways in which the educator can use the 5 elements of Find to build neural connections and brain development. So this is a 10-week program where educators who participate in Find are shown to improve their own efficacy and increase serve and return interactions with infants and toddlers. And so this leads to increased language learning, executive functioning, and helps children on their way to lifelong learning and success. So we have found that educators who complete find may also be eligible to receive an $800 the Trauma Informed Care Award through the Fair Start for Kids Act. So that is a really great incentive for this program. And so we are super excited that we get to expand that a little bit and add some more coaching for that. In addition, family child care home and child care center educators may receive program-wide support with developmental screenings from the B3QI coach, with these funds to include training on how to use the ASQ3 and the ASQ SE, support with holding an event for families about the ASQs, and to partner with them in completing the form as well as discussing the results, planning for regular screening of all children 0 to 5, and then in addition, the ASQ3 and ASQ SE kits and activity guides. So there are children who may need referral or further assessment, and the B3QI coach can help making those connections to the local community. And all of the training, coaching, and supporting materials are available in English and Spanish. So that's, so we're really excited that we get to expand that a little bit more. Let's see, does anybody have questions specifically about that? Awesome. Well, then I'm going to kind of switch it back over to Michelle, and I think we're going to open it up to, we have a few questions that I think we would like to ask you and get some feedback as well.
Yeah, thanks so much, Kelly. I know we're a little bit of back and forth, but hopefully that keeps you all on your toes, right? And sometimes a change in a voice is really helpful. I know that can help me too. So this is the suite of questions that we wanted to discuss with everyone today. And Jessica just put a SurveyMonkey option in the chat if you want to respond in that way. And that also means like if you're not responding like right away and you need like the rest of the day or any set amount of time that is we can identify here together, then we want to make sure you have an option to like go to that a little bit later as well. But I saw Gretchen came back on camera as well. So really our key questions for you are really just what ideas do you have for supports when professionals enter the field? We know we've heard from you lots of great insights and just want to kind of have like a fresh mindset with all of you and just kind of hear what's coming up on top, as well as things that maybe you've been thinking about for a long time. And then ideas for how we're engaging a diverse group of providers that would be representative of multiple perspectives. And then how we can best position you to provide feedback as an advisory council and what ongoing information would be most useful for you. So those are some of the things we have on top. And then I'll check in the chat as well and make sure that we're catching all of the questions that maybe have been coming up. And let's see. I saw something that said, excellent teacher education includes mastery of curriculum and assessment. DCYF needs to offer recognition of that level of professionalism and not require adopting a prescribed curriculum. Yeah, I'm excited to come to that discussion with Kelly in a moment, and just wanting, I mean, just the light touch that I'll give that I know, and Kelly will go into way more detail when we transition to that, is that this is really intended to be a no-cost option for those who need that, but not necessarily something that all would automatically access. Let's see, what else? So there was a question about connecting with tech skills centers, and definitely want to say that we're open to learn from communities the best ways to connect people, excuse me, to the information and access the training that they need. So I think as we connect with folks in our planning with some of our partner and contracted agencies, as well as providers, we want to hear from you and make those touch points as necessary. And Dave, I see your hand is up and I'm going to turn to you. I just want to make sure we got, how do we plan to recruit providers? So historically, we've worked with our contracted partners who work closely with providers, whether that's through coaching or training or things like that. And then they are able to do a lot of the outreach on our behalf because they have more of that connection and community. So that's our general strategy. And then the time commitment, I don't have an exact formula for you all, and I was trying my best to say that we want to have multiple touch points so that people can engage where it is best suited for what they're able to do. And like the most intensive, of course, being part of that design team that we would meet probably multiple times over several months and then try some things out and then come back and see how it goes. I'm going to turn to you, Dave, and then also keep tracking in the chat.
Excellent, thanks. I think this might fall under bullet number 1, but kind of 2 things. It seems to me that one of the ways that we could support folks when they come into the field is to create a automated journey for them. I think I would share that there's probably a lot of different checklists and things like that that people have created on their own to make sure that all of the requirements in merit and other things are done in the right order at the right time. But I think that also slows down our process quite a bit because if somebody misses a step, then it can be you're not necessarily with them all the time. You're doing your job and working in the classroom and such. So an automated journey for them from the beginning, as soon as they do a STARS ID number, to making sure that everything is green in their dashboard and merit would be excellent. And in addition to that, it seems to me that we could find a pathway for a recorded module approach from DCYF side for childcare basics. If I wanted to click today and just start, I don't need to wait for a cohort. I don't need to wait for somebody to do something. Obviously, there are purchased options for that, but that sometimes is complicated because there's extra steps for reimbursement and things like that if people need that. So that seems like an easy, low-hanging fruit piece because it already exists. The modules do. And so how can that just be a click on this link and start your childcare basics class at 11:45 at night on the day that you sign up for STARS ID number without having to go through this process of actually having to sign up for it?
Thanks, Dave. That is a familiar idea. I love that perspective. And we are absolutely interested in how we can make that a smoother process and really increase that access at the front with no cost as much as possible. And if it's all right, if you all, Dave, if you didn't put that in a survey, I want to be able to capture it. Is it okay if I maybe just like either add what you said in the chat or invite you, Dave, to put in the chat or the smart sheet? I don't want to lose track other than just my handwritten notes.
I'll put it in there.
Great.
Cool.
Other thoughts or questions that are coming up that we can pause and think about with all of you?
I want to emphasize the last bullet point about the ongoing information that would help you best provide feedback. What would that communication look like? What would those resources look like? If you have thoughts about that, I would be very eager to hear them. Wonder whether we should move on to the next slide.
The next slide, we just had a couple of questions specifically for the increasing support to serve infants and toddlers. Again, you can feel free to come off mute and answer these, or they are also in that survey. So feel free to whatever works best for you. But some of the things that we're hoping to hear from you all is what information would you like to see shared out about the success of this expansion of services? And then how can we promote this opportunity for expanded services to rural workforce members in Central Washington? So those are the kind of the two things that we're hoping to hear a little bit more from you all in both of these, both the provider supports and ELAC groups. So again, if you have ideas or have feedback, I'm going to open it up to you all now here, but also you could put it in the survey as well. Okay, well, I think, Matt, are we ready to move on to, I think, a highly anticipated topic?
Yeah, based on the chat, it seems
Based
like,
on the chat, I think we're gonna have a lot of really great discussion. So I am also going to talk a little bit about the curriculum project. You can go ahead again. So the goals of creating an open source curriculum is to have a freely available curriculum that provides engaging and culturally relevant activities for children across all areas of child development. We are going to take a design-based approach with opportunities for educators to try things out in partnership with content designers and provide real-time feedback. And it will also be developed with a multilingual simultaneous design. The curriculum will center family engagement. We are really going to work hard on making sure that the resources needed to implement the curriculum will be carefully created to ensure that costs are realistic for all program types. We are taking this as kind of the basis for the development. We have not started developing this. We just were awarded this grant, so we're not like halfway down the road or anything. We're right at the beginning, so we really want to make sure that we hear educator voice throughout the development. Could you go to the next slide, please? The next slide is about the need in Washington State. So I know that there were a couple chats about how curriculum is required in the state of Washington already, and so everybody already has a curriculum, but in a sample of 3,700 programs, 63% of those programs report using a curriculum that does not meet national standards or report not using a curriculum at all. And so there is a need in the state of Washington for a free open source curriculum that you can choose to use. I do want to be clear that our intent is not to require this curriculum to be used, but this is something that people can choose to use that is a free cost to them. So there's no cost. If you already have a program that you use and it meets requirements and you love it and you want to continue using it, you can certainly do that. But we did want to fill this need that we clearly see. Also, in a sample of 3,154 directors, 1,700 said that they would like to attend professional development around curriculum. So again, directors and leaders at childcare centers are indicating that they would like some additional help around curriculum. Also, the cost for curriculum kits plus training can be more than many providers have the budget to support. So in Washington, programs are not currently all resourced the same to be able to purchase a curriculum that meets these standards that is evidence-based. The curriculum can cost thousands of dollars and also include costs for ongoing training to make sure teachers are supported and consistently used with confidence. So creating an open source curriculum for Washington will ensure that all programs could access a curriculum that meets these standards, including something that's developmentally appropriate for children, has engaging and culturally relevant activities supporting all domains of child development, and includes meaningful ways to connect with families and suggests using materials that can be acquired at a cost that is reasonable for all learning facilities. So Washington's curriculum will meet educators and programs where they're at and provide activities that are engaging and motivating to children alike. And then could you go to the next slide? I want to talk a little bit more about the curriculum development plan. So over the next 3 years, we're going to use a multilingual simultaneous design to develop and test out an open source curriculum for all Washington State early learning programs. We're going to focus on developing engaging activities that can be adapted for each program's priorities while supporting all domains of child development. The resources needed to implement the curriculum will be carefully created. I've said that a couple of times. I want to make sure that you know that we're going to really try hard to make sure that these are cost-effective activities. And then another thing that, you know, we could do or we would want to do is build communities of practice and places for educators to share activities and ideas with each other once this curriculum is developed. So I think we have a few questions for you. I see that there are lots of questions in the chat as well. So maybe before I guess we can do questions for feedback and then I'll go to the chat. So the questions that we're hoping to hear from you all about specifically is, what ideas do you have for recruiting educator design circles to ensure representation across the state? Because during that design, we do want to have educator design circles from all areas of the state. So what are some ideas on how we could effectively do that? What ongoing information would be most helpful for this team to ensure you can provide meaningful feedback? So what do you need from us? Like, how often would you like to hear from us? How often would you like to provide feedback? That sort of thing. And then what existing channels across the state, such as community groups, organizations, social media, etc., can be used to highlight progress and share ideas and build state momentum? And then you can also look forward to information on the design-based model coming soon, including ways for educators to get involved. And so I think that we do have a separate Survey Monkey where, again, you could feel free to jot down your thoughts and put them in that survey so I can make sure that I have all of that accurately recorded. Otherwise, you can feel free to come off mute. And I see that lots of people are putting some questions and or comments in the chat. So let me scroll back up and see. So who will be creating the curriculum? So we are contracting with our partners at Cultivate Learning through the University of Washington to facilitate and help create this curriculum. They will be, like I alluded to earlier, we will be engaging in educator design circles throughout the process. So it will be co-designed with educators in mind. And then Julie says, choose to use is always a concern. Early achievers was initially a choice until it was required. That's a good point. Our intent is not for this to be something that is required. Our intent is to fill an obvious need that we have heard. As I shared earlier, 63% of programs are not using a curriculum that is evidence-based or a curriculum at all. And so the intent is to fill that gap and have something that is freely accessible for all providers in the state of Washington, regardless of cost. A free curriculum is a shortcut to classroom management, not a teacher development plan. Funds are needed for true professional development. Plans need to emphasize a career instead of a package. So this open source curriculum is not meant to fulfill a workforce development specific need in this PDG grant. And so I guess if you have more to say about that, maybe you could come off mute because I'm not sure I understand. If not, that's okay too. Let me see, another question. One problem we're encountering with much of the curriculum is we need a much stronger emphasis on social emotional development, which we find lacking currently. I think that that's really great feedback, and we would love to hear that and make sure that that is incorporated in the development of this new curriculum.
Hey, Kelly, it
yeah.
sounds like maybe this grant has already been written and approved, so you probably have
Yes.
parameters around what it can be used for. So rather than us all sit here and give you suggestions, can you kind of give us the guidelines of what the grant specifies? Because I think what you're seeing in the chat is a lot of feedback from providers saying, don't reinvent the wheel. There's already things out there, use the funding for this, but there's no point of us giving you these suggestions if the grant says it has to be specific to whatever you were awarded. So can you share a little bit more about the guidelines of your grant approval?
So I can do that. Yeah.
I can speak to that. So the contours of the open source curriculum project that Kelly has described is what we put into the grant application. And so that's what the federal grantor is expecting us to move forward with. Within that, we do have a lot of flexibility to make moves in how we implement. But the broad project of an open source curriculum, I think, is what we're more or less locked into. The how we do that and the contours of how we engage, and develop it and working with communities. I think those are all open to suggestion. But redirecting the funds, for example, to purchase off-the-shelf curriculum that already exists wouldn't be on the table, and I don't think would have been awarded these funds because of the limited impact to the system an approach like that would have.
So I appreciate that, and I'm curious, with suggestions as far as maybe putting curriculum training in the DCYF option that's not specific to a certain curriculum, because I think what I'm hearing from the group is more around, it's not the curriculum that teachers needs, it's the support services around development that they might need. So like, is there a way to tie those two together, or does it have to be an actual and I keep thinking box curriculum, that's what keeps coming to mind. Like, does it have to actually be something that is developed where they do a lesson plan, something similar to high scope or creative curriculum or all the other many curriculums resources that are out there?
So I will say that is great feedback, and I think that that should be something that I will bring back to the group for during the development phases. But I also would say that as part of creating this curriculum, there will be like some sort of like training or support that would be built in, I think. And this is very open right now, and so this is not a for sure thing. Maybe we could have early achievers coaches would be trained in it so that they could help support providers through that. That's just an idea. We're not 100% tied to that right now, but there would be support in implementing the open source curriculum that is developed.
And sorry, I don't want to bogart the whole meeting. I just there's a lot of, I'm sure, thoughts that people are having. The other question I have is curriculum is very risky, especially when you start getting into theory and philosophy, and for the state to decide a specific, like, how are you thinking in regards to the theories and philosophies that are out there for programs, and how are you going to align that, even when you're thinking about what you all said around cultural practices, family engagement. A Montessori program looks very different than a Waldorf program or a Reggio program or some other inspiration. So how are you going to tie in all of those theories and philosophies?
Yeah, and I think that that's something that group is still looking into, how to do that. And I think, again, that the educator design circles are going to be really integral in providing feedback on what would work best for their programs, and making sure that we are incorporating those diverse viewpoints and incorporating the flexibility to be used in a way in which works for your program. Susan, I see you have your hand up.
Yeah, I'm a little bit concerned about the involvement of Cultivate Learning because what we do know is that they were involved in designing PACE and that has not turned out to be a good, and because they have the power and the access and the credibility, how much will childcare provider voices actually even weigh into the process? It's very concerning to me that, as Julie pointed out, childcare wasn't involved in the decision to do this. Because I think, as Darlene pointed out, I don't think there's a need for more curriculum. There's a need to support the work that we're currently doing with regard to curriculum delivery. So has the train left the station on the Cultivate Learning people, or can we back it up and actually engage with providers first if this is the road we have to go down now, which is this open source curriculum?
So the reason that we put this into the grant is because, as I said earlier, 63% of programs in Washington State are not using a curriculum or are not using a curriculum that meets evidence-based standards. And so that's over half of the population. And so I do think that there is a need for a curriculum that is open sourced.
Can I ask how you gathered that data? Because emergent curriculum isn't necessarily a box curriculum. And so I actually question the data. I'd like to see it and how it was collected and which centers was it based on observation, self-reporting?
It was collected through the early achievers process in the program profile. There are questions about curriculum included in that. And so based on those responses is where we saw that need.
So then are you saying that early achievers rated people, like, does that relate to their rating? So like, is 63% of providers not rated as quality programs? I mean, I'm trying to
No,
figure
63% of people have reported that they're either not using a curriculum or using the emergent curriculum, which isn't guaranteed to be evidence-based. Because emergent curriculum is you make up your curriculum.
But there's still assessments then being made by DCYF staff about how to interpret that data as to what it actually means and reflects. So I'm even concerned about that, but no surprise there. I would like to see, I think there wasn't good enough work done in that regard either. But I think this is we don't need to spend more money on these kinds of things. We need to spend it on the things that providers identify as a real need. So anyway, that's my 2 cents worth. Thank you.
Thanks.
Kelly, I see another.
Yes. Oh, yes. Thank you. Representative Mari Levitt.
Get off mute. Thank you for the conversation. I just want to reinforce the concerns of the providers in terms of adding additional responsibilities and change. The other thing I would say is in a time, I feel like I'm the gloom and doom girl right now. I just, in all the conversations, and it's all centered around the budget. But in a time of extraordinary deficit to our budgets overall for the state of $11 billion, grateful, the initiative was kept intact, and we're not going to even be in a broader challenge than we already have. But I just think that every penny spent has to be very thoughtful and used towards the best outcome and the most successful outcome possible, which really means that we're asking everyone to reevaluate how they do business and ask very hard questions of does this make sense to use our dollars this way because of the budget and the nature of the challenges that we have ahead of us this year with an $11 billion crunch just for maintenance. It's going to be a tough road ahead. And so I think maybe what was planned 3 months ago, 6 months ago, may need to be reevaluated in light of our budget challenges and in light of recognizing that we want child success. Thanks.
Thank you. Julie, I think you have your hand up as well.
Can you address the question about the data split between homes and centers? I think most people would assume that centers are using curriculum, but maybe that's a bad assumption. I'd love to know about the split in the data.
I would have to look. I don't have that data right in front of me. The split between who's reporting, you know, versus childcare centers versus family childcare centers. Is that what you're asking?
Yes, and I wasn't asked as a provider if I'm using curriculum. Who was asked?
That is a question that is in the program profile in Early Achievers.
Oh, so it just went to Early Achievers, folks?
That's the data that I specifically was using.
Yeah, so if somebody could get the data about homes versus centers, I think it would be important to.
Yeah, I can do that. I can follow up with that in the feedback loop.
I think what I'm hearing is that the percentage of 63% is a little misleading. Meaning that most programs are not using early achievers. So it's not 63% of all providers. And then you've got a whole host of people on here that weren't asked. So when we get data like that, it's just a little, there's always that little question of like, who is doing this data that comes out making the programs look like they aren't professional? And then that just makes us bristle a little.
Sure. I do just want to say that most programs are participating in Early Achievers. I would say if you accept any subsidies, it is required to participate in Early Achievers.
Sure, but the majority of the programs that exist are probably not taking subsidies. I mean, I've got 10,000 kids that are in schools that aren't taking subsidies. So I that would be interesting too, to see what percentage of students are receiving care from folks that are in early achievers versus that are not in early achievers.
I can also get you that exact data as well.
Kelly, I see another hand raised.
Oh, yes. Thank you. Veronica?
Yeah, my question is, what will they be doing for when they authorize the dollars to the nonprofits or the organizations? Are they going to take into consideration like feedback from providers of them places about, you know, like if they authorize certain amount? Because there are some that DCYF has awarded dollars to, but when we're out there seeking their support, it's extremely generic, and I really feel it's just a waste of money when I'm seeking support and they're just redirecting constantly. And being that it's something with curriculum, I feel it's extremely important to have people that are qualified that know about the curriculums and that kind of stuff, not just place people that are just going to provide training, or their feedback will just be circling around again.
So when you say give dollars, do you mean for the contract for who's going to develop it?
Correct.
Oh, so can you reframe the question? I guess I'm not sure what you're saying.
So if there's a contractor that's going to be awarded the DCYF dollars to teach and support the community educators with how to, you know, learn about the curriculums, are you guys going to take prior feedback from those organizations? Or maybe I can just call you
maybe just
directly.
Yes, maybe I can put my email in the chat and you and I can connect.
Okay, perfect.
Sure.
I'm seeing some additional questions in the chat, or at least one from Debbie, the new one from Debbie.
If a provider qualifies for Working Connections childcare and working with early achievers, they're not required to have an evidence-based high quality curriculum. I think that we are saying that they should, but we are
Well, she's
finding.
yeah, sorry. She's asking that as a question, I think. I'm seeing the question mark, but I think the idea behind the curriculum piece in terms of the programs that I work with that are with early achievers is you could get a higher score if you use one of the evidence-based curriculums, but it's not a requirement. So I think that's maybe sometimes where some of the answers came in with that 63% too, because on the program profile, you may not be using it when you do that program profile, but you may consider it in the future.
Absolutely. Yeah.
But you also may not go forward with it because of the cost and things like that, which I know is what you guys are trying to work with. I think the challenge that we're having, and Susie said this a little bit too, and I'm seeing this not just with this curriculum piece, but also with just a lot of the projects and initiatives that come out, is that everything is so centered towards early achievers. There are, and I'll just use this as an example, I have 56 programs, only 8 of them are early achievers. And so there are a lot of programs that are not involved in the early achievers program. And so when things are kind of built on this platform with early achievers, I think that that's when we're not looking at the industry as a whole, and we're just looking at it from the providers that are participating in that particular program. And so that's where sometimes these things need to sometimes they get skewed a bit because of the perspective of starting with the programs that are either taking subsidy or are participating in early achievers. I think there's 6,000 licensed programs, something like that. I don't know how many early achievers programs there are, but if you take my programs just as an example, it's not as many maybe as we think.
So I actually was able to pull up, and I can put this in the chat as well, but we do have an early achievers data dashboard that that is freely accessible for anybody to look at, that tells you about participators participating and their rating status. And there are 5,963 providers currently in the state of Washington. And of that, 1,051 are not participating in early achievers. And so that means I didn't do my math that quickly, but I think that there's about 5,000 that are participating. Just to put that out there, and just so that it is you can see the breakdowns.
When you were collecting your data, did you ask providers why they've chosen the curriculum pathway that they have? So like, for instance, some people may like emergent curriculum. And so, I mean, I feel like there's some arbitrariness to this that feels very uncomfortable and very much in line with what we're hoping to change in the DCYF culture, which is you guys know better than we do. And you ask us after the fact, not before. So I just, I want to caution that you make assessments and that may be influenced by bias as a consequence of not having thoroughly vetted data. So I feel like we need to back the train up a little bit here. I'm not sure what that can look like, but I don't personally feel comfortable just moving ahead with this project without further background and review, and maybe doing what we can to change it so that we can swallow this pill a little better.
Sure. And honestly, I hope that you don't have to swallow a pill, because if you have a curriculum that you are using and you are happy with it, you can feel free to continue using that curriculum. The idea of creating the open source curriculum is to help fill the gap for those programs who do not have a curriculum or who want to use this free curriculum. And so I do want to emphasize that because we are trying to fill this gap for those providers who have expressed that they don't have a curriculum or want to engage in learning more about curriculum, that you can continue doing what you want to do with the curriculum that you currently have. The intent of this is to fill the gap for those providers who do not have a curriculum and would like one. I do want to just make sure that that is the intent of this, and it is not DCYF is not creating a curriculum that everybody in the state must use. It is to fill this gap that we have heard that needs to be filled.
Can you repeat that number regarding the providers that are not utilizing EA? Or not enrolled?
Sure. I can put the link in the chat again. But this is the Early Achievers dashboard that's on the DCUF website. And right now it says that 5,963 providers in the state of Washington are providing childcare services. And then of that 5,963, 1,051 are not participating in Early Achievers.
Interesting. The numbers in childcare check are a lot different than that.
Yeah, I think you need to play around with the dashboard for a minute. So take a peek at that. But I think it's important for us to remember that we may have some ideas about curriculum. This project is moving forward. And we all use curriculum. And so there may be an opportunity here to give her some feedback about what we like about the curriculum and how it's used in our programs that would help feed the curriculum that they're going to develop. Open source is, available to all, which is nice. So I kind of wonder if there's anybody that has anything that for a curriculum that they really like, and maybe we should start from there, because the project's moving forward, and even though we wish that they would spend their money on other things, they didn't ask us that. They asked us if they're going to spend the money this way, what are great ideas about how to do this well. So I know that there are wicked smart people on this call, wondering if anybody has any ideas for her about the curriculum piece.
Yeah, and I would also, I'm open to anybody giving any ideas right now, but I also want to just extend that as part of this curriculum development project, we do want to hear your voices. And so if you are really interested and you are passionate about a curriculum and what you want to see in it, we welcome you to become a part of those educator design circles to influence what this curriculum could look like. And when I have more information about those, I will make sure that I communicate that to this group. Carlina put in the chat, I'm passionate about the delivery. Is this an opportunity for you? Opportunity your work will cover, such as coaching, data collection, and personalization? Absolutely, yes. I think that is definitely something that we want to hear about and incorporate throughout the process of the development. Sandra or Sandra. I'm sorry, I may have said it wrong.
Doesn't matter. Good morning or good afternoon at this point. Will you consider the fact that even though you will be developing an open source curriculum for providers, that there are always costs in implementing and maintaining curriculum? Be it
Yes.
supplies, materials, training, whatever, and figure out a way to be able to support the providers in order to get that part of it too.
Yes, and that is something that I mentioned earlier is a big focus of development of this curriculum, is making sure that the resources needed to implement the curriculum will be carefully created to ensure that the costs are realistic for all program types. And so when we're designing whatever the activities would be, always keeping in mind like what resources could we be using that aren't an exorbitant cost to providers is one of our goals as well. And then I guess Matt just answered it, but another question was, will there be incentives to use the curriculum? And that was not discussed in this grant application, and it's not funded in our current grant. And I did just want to point out, just to remember that this is the PDG grant is from the federal government. It is not from DCYF or from the state of Washington. These dollars being used to create this curriculum. Awesome. Well, I know that there's lots and lots of feedback. And so if you haven't filled out that survey, please make sure that you fill out that survey, because that's going to be the easiest way to make sure that I get all of your thoughts and information, and I'm able to collect them and use that to help inform this project moving forward.
So that is all the material we're presenting today. And I'm aware of the fact that we're wrapping up pretty early. So I guess I did just want to open the invitation again up to kind of what Darlene was talking about earlier. You know, the open source curriculum project is funded by the PDG grant, and we're moving forward. So recognizing that there's feedback, you know, critical and constructive about you know, the project that we outlined. If there is suggestion about how we proceed forward on, you know, based on Kelly's questions, I just want to open up the call one more time for that feedback. Or on the workforce supports projects that were discussed earlier, since we have the time. So Michelle is asking in the chat, is the grant funding enough to develop, implement, and provide ongoing support? I anticipate that there is not going to be future federal funding. So just to provide a little more information, this is a 3-year grant with only the first year locked in. So years 2 and 3, we'll have to apply again. As Delta referred to in the slide, we've been through a 3-year cycle of a renewal grant before and received funding. So I'm optimistic that that will still go through and that we'll keep moving this project forward. In the application, you know, we laid out a 3-year timeline for all the projects and where we wanted to see them go, you know, in hopes that that PDG funding would continue. So and hopefully continue beyond the 3 years in a new renewal grant. So we don't know the future, but continue hopefully.
Oh, just one quick last question about the data. Can you break it out in terms of those 63% who responded? Do you know if it's licensed, what the breakdown is of licensed centers and licensed home providers?
That is a request that Julie also made, and that I don't have that information right in front of me, so I will need to follow up with you all in the feedback loop specifically about that breakdown.
Sorry, Julie, I didn't see that. Apologize.
No worries, no worries. But I have that on my list, and I'll make sure that that gets communicated to y'all.
I'm wondering if Enrica is gonna move us forward, or should I? Enrica, are you there?
Hey, Marlene, real quick.
I just wasn't sure if you were still facilitating, and it looks like Michelle. Yeah, go ahead.
Yeah, sorry, Enrica. Thank you so
That's
much.
okay.
We're all
No,
kind
no.
of coming in at the same time. And I don't want to I don't if we don't need the additional time, like great, like let's give everyone that gift. And do want to, I mean, I know folks may be completing the Smart Sheet survey, but one of the things that I was still wondering or thinking if there's time or ideas that folks had in mind, I was really thinking about the health and well-being supports, and really wanting to note, like noting that that is something that's been emerging. And I think we've heard so many great insights from all of you, and you shared some really great insights again today around the staff qualifications, but I'm curious if there's something that is coming up for anyone or related to the health and well-being supports. I don't want to take away from the curriculum conversation if that's still on top for folks, but I just, before we break, wanted to invite you all again to share anything around the health and well-being. And for example, like one of the ideas came up around, in addition to helping navigate and find health benefits, was also some thoughts around what other are sort of lighter touch options might there be, that if you think about having like a strong workplace environment that maybe has health and wellness benefits, like access to a community membership for fitness, or things like another one I had heard shared was access to some wellness apps on your phone, and things like that. And so just wanting to know and like hear any kind of like creative ideas or things that you may already be doing or thinking about for health and wellness of staff. And just want to pause if there's any chance to glean from you on that before we break for this topic. Oh, back to the question about the federal department, it's the Health and Human Services. So the same section of the federal government that has Head Start has this preschool development grant and CCDF. Giving a nice pause for you all, but also don't want to draw it out too long, Enrica. So I'll follow your lead when we're ready to switch gears.
We definitely do have time, so we can give another, a few minutes or so. Perhaps folks are formulating their questions. Sometimes it takes a little bit to enter questions into the chat.
I didn't cover a part of Lois's question, or LM, sorry if I got that wrong. I think that's Lois. So I'm not aware of any specific information that would suggest that PDG is going away under the next administration. However, you know, we've since its inception, it's always been a question, how long would this continue going? It's lasted through a couple different administrations. And so, you know, I'm hopeful in that regard and proceeding on the assumption that we're going to fight for, you know, PDG funding going forward.
Thank you, Matt.
I see Sandra had a hand up.
I did. Now, you're talking about health services during this little bit. Is this services to our families, or is this still the healthcare provision that we're working on for providers?
It's for providers, and it may not be like the full suite of like healthcare provision. I think with the federal funds, we're really thinking about health and wellness supports that may be accessible in a shared cost structure or in a coordinated way. Whether or not it's specifically health insurance isn't necessarily the intent, knowing that there was at one point supports for that for providers, but it is, yes, thinking about health and well-being needs broadly for the provider, not for our children and families, but for you as providers and your own health and well-being.
Thank you.
Well, thank you everyone for the discussion. It's kind of simmering down, and so we're early, but Enrica, maybe it's time to turn it back to you.
Yes, I do see one question, but maybe it's more of a one that's to make everyone be thinking about from Debbie. You know, Debbie asked the question, I wonder what might be an intentional harm down the road to providers who engage in an evidence-based high quality curriculum.
I wonder, Debbie, if you're able, if you had anything in mind about a possible unintended consequence around the open curriculum project for other providers already using an evidence-based high quality curriculum. Could you say more about that?
I'm just thinking out loud. I'm gonna put my thoughts in the survey.
No problem.
Great. Thank you. Thank you, Debbie. And thank you, Matt, Delta, Kelly, Michelle, and Gretchen. Didn't want to miss anyone here for the questions. And thank you everyone for the discussion. With that, I'm going to turn it over to Julie. We are early, but that's okay. Also, just as a reminder, you know, if you have additional questions, please make sure to enter those into the meeting reflection survey form. With that, I'll turn it to Julie.
Okay, thanks, Enrica. So we are early, which is nice for all of us. There is the reflection survey. I think we've got a Mentimeter. Jessica's going to drop in there. And then, you know, take a few minutes to fill that out. You can do any topic that we've covered today. And then we just want to remind that the next ELAC FSKA report development meeting is scheduled for January 7th The next ELAC meeting is scheduled for February 4th, and the next provider supports meeting is scheduled for January 22nd. So that's everything today. Have a great day. Thanks for joining us today, and thanks to our presenters for being here. Thank you, everyone.